Good morning, everyone. How are you? I'm glad that you could join us on Tmag's first ever virtual convention. We have a lot of people coming in, and I'm so glad to see that. You are all very welcome. We will get started shortly with a brief welcome from some of our officials. And I would like to introduce you to my co-host, please. This is Mr. Sadiq Roberts. He is with Pittsburgh PGH, Marketing and Advertising here in Pittsburgh, and we're lucky to have him with us here in Pittsburgh, and I'm glad to have him with us today.
Good morning, everyone. Thank you for having me.
Yes, sir, you're welcome. Glad to have you with us. So as we go in through the day today, I'd like to tell you a little bit about, you can see my name, it's Roxanne Sewell, and I am one of the hosts today, Luther Sewell and I, with Tmag, Talk Minority Action Group. It's our statewide organization that works on civic engagement and civic education. We try to work with as many politicians and candidates that are trying to make a difference across Pennsylvania and make a difference for Black people and other minorities and underserved communities. So Tmag is glad you can join us today. We have some dynamite speakers. We will have a slight welcome from Mayor Peduto for the city of Pittsburgh and Rich Fitzgerald for the Allegheny County. And as we wait for them to join us, we will keep going along. So before I go too much further, what I would like us all to do is take a moment and clear your minds and thoughts. We always have a prayer as we start all of our meetings, and I would like to do that today. I was looking in the waiting room. I don't see a specific minister that's with us, so I'm going to do it, and I'm glad to do that. As we say this moment of prayer to ask for help through this meeting, for new ideas, for graceful and meaningful conversation, we ask God to take us through this day and to give us all hope and consideration for our human beings in this time of crisis across our state and across the country and across the world. Please, I have to ask that God gives it in your heart to do something simple as wear a mask when you're out in public. Make sure you always wash your hands. Take care of your family and take care of others. And we'll discuss ways to do that as we go through this day today. Thank you for bringing everybody in safely. And we give thanks to our Lord. In his name we pray. Jesus Christ, amen. Excuse me. So while we're in that frame of mind, I'd also like to have 1 minute that we can have a moment of silence for our lost hero, Congressman John Lewis, and what he meant to Black people across our country. You know, we all look at heroes, and I think that we just lost one of our last heroes of my lifetime, and I'm sure most of yours. So I don't mean to sound so somber, but his life was important. And we must carry on, not just for Black people, but all underserved people, brown people. So we'll just take 1 moment. I'm going to watch the clock. It won't be long. Keep him and his family in your hearts, and the movement to make a difference in Black lives, because they do matter. Thank you all. I appreciate that. I'm sure his family appreciates our condolences and our support. So I don't believe I'm going to check something. Sadiq, if you would please talk to our guests about what we need to, some few housekeeping notes. Thank you.
Absolutely. Good morning again to everyone and everyone who's come in since the call has began. My name is Sadiq Roberts, co-host with Roxanne, and the few housekeeping tips that we have are going to be, we're asking that everyone insert all of their questions or concerns into the chat function, which we've made available. And throughout the convention, we're going to be offering question and answer periods following the initial panel with our speakers, and then we're going to allow them to address all of your questions there. So as we're moving through the session, just so that we can have some smooth transition, we ask you to leave all of your questions there. Additionally, highly recommended that everyone get their notebook, their pen, their highlighter, any stationary equipment that you need to make sure that today is as fruitful as possible. We are also recording this session today, and is also being live streamed to our Facebook page, which is available at Tmag on Facebook, and it'll be available there. So if anyone was not able to register in advance for this program, please refer them to that page and they'll be able to follow along with us.
So, hello. I was, excuse me for my learning curve. That may happen a couple times today. I appreciate your patience. So let's do one more bit of housekeeping that always makes me feel good, because a lot of the work that we do is supported by some very important sponsors. And I'd like to read our list, because at this juncture, I do not have a sign for you, but we want them to know that they're important to us and the work that we do. We have First Energy. They are a continuing sponsor of ours, and we appreciate that. Likewise, Highmark does a lot of work with the minority community. Gateway Health, an important part of our community across the state. And I see we have our panelists from Gateway Health on. Good morning. We'll be with you soon. United Steelworkers, they are a big support in the union area across the state. They support us, and we try to support them as well. PA Housing Finance, Miss Allie is with us today. She's a wealth of information on housing. And Brian Hudson just retired from there, and we will miss him, but hope that we can develop a relationship with the new leadership and help them in their work to help others. UPMC, again, one of our continuing sponsors, and we appreciate all of them. And Allegheny County Housing Authority, they are always there to help us and to help others. And we want to bridge that gap today and see if we can get some help for people and give them some information on how to get help. Mm-hmm. So those are our sponsors, and we'll remind you again as the day goes on and as we get moving. So I don't see, let me keep looking here. I don't see that, okay. I don't see that the mayor or the county exec have come into the meeting yet. I just want to make sure that we keep moving. It's a little bit before 10 o'clock. I see that we have Gateway. I think, oh yes, Ms. Jenkins is here. And
good morning.
Good morning. And I thought I saw, we will start the, yes. Good morning, can you hear me, Dr. O?
Good morning, I hear you loud and clear, thank you.
Okay.
Now, as we wait on the county exec and the mayor to come into the call, I'd just like to introduce our panel for the healthcare session. First, we have Dr. Aurelia Dominique from Highmark. We have Ms. Elaine Jenkins, RN, member of the Black Nurses Association and president of the AARP in Pittsburgh, as well as Cesar Nunez, who has been with Gateway Health Plan for the last 8.5 years and is serving as a bilingual licensed medical sales agent. So thank you all for being here with us this morning. As Roxanne said, we're going to get started here shortly once our guests arrive, and we will be beginning. In the meantime, however, for our panelists, would you all mind giving us a little bit of background into your organizations, some of the work that you're doing, maybe some inspirations that have stood to encourage your personal individual affairs within your organization? Dr. Aurelia, we could start with you.
Thank you. Today, I would just want to thank everyone for allowing me to be part of this important outreach and this important conference. My name is Dr. Aurelia Garcia Dominic. Tonight, I am participating as a private citizen, and I will be highlighting resources that we could use to better mitigate the efforts of COVID-19, especially among racial and ethnic minorities, and how to better protect them from getting it, spreading it, or dying from it. And I'll be presenting the COVID-19 Preparedness Toolkit. That work, a little bit of background, was co-authored in collaboration with Dr. Eugene Lengridge, who is an epidemiologist as well as a cancer researcher at Penn State College of Medicine. The department is Public Health Sciences. And we put together a toolkit that captures different scenarios that one might face during a pandemic, rather at home, at school, at work, or in the environment. So today I'm just going to be presenting to you as an author of that toolkit and giving you strategies to use, what to look out for to better protect yourself, your loved ones, your neighbors, and your communities from getting COVID, from spreading COVID, or dying from COVID. So again, thank you for this opportunity, and I will now turn it over to the next panelist.
Cesar, I'm sorry, you're muted. You give us one.
Okay, can you hear me now?
Yes.
Okay, I'm new to the Zoom. I don't do a lot of Zooming, but thank you all for having me. I really appreciate the opportunity. Want to thank the company for supporting us and supporting everything we do. Again, my name is Cesar Nunez, if you guys didn't get to hear me. I'm a licensed Medicare sales agent for Gateway. My job is to assist our senior population and disabled population to access health care and all the benefits associated with healthcare, such as vision, dental, transportation, and other benefits such as over-the-counter benefits and things like that. I assist providers as well when they're in a situation that needs attention. Gateway celebrates differences, and African Americans, along with Hispanics, have certain barriers that need to be addressed. Gateway addresses those by being proactive within the community that they serve. Multiple factors contribute to racial, ethnic, and health disparities. African Americans suffer from cardiovascular disease and diabetes. Gateway Health Plan covers all those factors. Socioeconomic factors, of course, education, unemployment, and income are things we cannot control, but have repositories of information for them. Periodic mailings, information. Members remember to protect themselves from COVID-19, tips and how to do so. Okay, so we have a lot of resources for them. I'll pass it over to the next one.
All right, fantastic. Thank you.
Thank you.
And now we have Ms. Elaine Jenkins. If you could a little bit about your experience in your organization, please.
Yes, good morning, everybody. And thank you, magazine here that is allowing me the opportunity to speak with everyone this morning concerning health issues. I've been asked to let you know what the importance of African Americans is to be safe and what to do and how to move forward during this pandemic that we have here. And one of the things that I've found working with the aging population is social isolation. That's been a very, very large barrier determinant that I've found. And with AARP being one of the largest chapters here in Pittsburgh, we have identified ways that we can help with the social isolation by keeping in contact with our members, our chapter members, on a frequent basis. If they need resources, we are able to provide the resources or give them information where they can get help. So we've done a lot in the community concerning that. And in addition, I'm a member of recently a member of the Pennsylvania Council on Aging. And we are a body that helps to make legislation here in the Pennsylvania area. This was an appointment by Governor Wolf and approved by the Senate. So there's a lot of things that we'll be able to prayerfully make some changes and benefit the aging population as well.
Hello, I'm back. That's kind of a little convenient, huh? So I did notice, if I could ask Dr. O, if you could unlock your video. I was trying to, oh, there we go. I did see. Okay, and so we were going to get everyone to have a brief moment, which we just had with Mr. Nunez. Nice to meet you. Thank you for joining us. And Ms. Jenkins, likewise. Thank you. I love the beautiful artwork behind you. That's lovely.
I'm actually in my RV.
Oh.
Yes, I'm in one of my RVs. I have one outside, a drive one, and then this is the pull one.
Oh, I'm coming over then later.
Yeah. Trip a pool, so you're welcome.
Great. And Ms. Jenkins,
Yes.
thank you for coming. We appreciate that. I'm trying to reach Dr. We affectionately call her Dr. O. She's working with us for many, many years now. Can you hear me? Yes.
Yes.
Correct. I can hear you, and I have just shared my video or accepted video, so it should be loading momentarily. I will refresh it in the event it does not appear within 30 seconds.
Okay.
All right. Thank you, Roxanne.
Oh, absolutely. We're glad you're here with us as always. We met Dr. O several years ago in Harrisburg as she was working then for another hospital up over in Harrisburg. And when we traveled to Harrisburg with our event, she would join us there. She's a great public health servant, and she works diligently for African Americans and Latinx communities across PA, helping us with our healthcare problems and finding a way that we can help ourselves and do better as we go, and especially through this COVID. She's authored a phenomenal toolkit that we will be sharing with anybody that likes it. It is online, so we can send it out to you and you can enjoy it. It has a wealth of information in it. So let's be sure and ask lots of questions of our participants today so we can get as much information as we can. And I will be sending out a short survey for you. More than likely it'll come through Google. So if you wouldn't mind, take a look at that and answer our survey so we can help to improve. If we're going to be doing virtual, well, we can see a lot of each other. We just have to do it this way. So that's a good thing. Okay, Let's get this panel started. Let me take one more look. I think our other guests may be here. Just looking to see if I see anyone. One more time. Okay. So I'm going to start opening up the video if I can. Sadiq, I'll ask you to do that. Let's open up some video and see if we can't get this panel started. And so, okay. So we've done some introductions. Do we have any? We do have one chat. Oh, speak up. Is that for me? That's usually what everybody tells me. So I apologize. I'll try and speak up a little bit. We can also ask everyone, if you would please, to check your own volume as well. Sometimes we don't have it up high enough. Yes, I think we got you in the call, Dr. O. So if we can, let's try to get started and see if we can get into the first topic, which let's see if Mr. Nunez can give us some help on some of the people here that I'm looking at that you said you do specialize in the Medicare. And I think that we have some folks that would be interested in that as well.
Yes, that's correct. And Roxanne, it's a pleasure to meet you. Pleasure to meet you all. I'm honored to be here. Thank you for the invite. I've been with Medicare for 9 years with Gateway, and you know, we like to we do things with the community that a lot of people don't realize. Our core values, we like to partner with healthcare organizations, and backed by our mission to help care for the whole person in all the communities where they live. So we are here to assist in pretty much everything that they would need. Obtaining access to these services can be challenging, like I said, in many ways, but Gateway is here to help.
So
you said something, I'm sorry.
No, I was just agreeing with you. Yes, sir. Yes. How do they access the information that Gateway has? How do they do that?
Well, we have many. Our website is packed with.
Good place to start. Yeah.
Yeah, but again, we do partner with many organizations, and they have access to a lot of our services. We do have a repository of information, whether it's housing, jobs, or whatever. We try to help out. While participating with these virtual meetings, I'm finding that we all have something in common. Organizations, for people to be with Gateway Medicare Assured, they have to have the eligibility.
Sure.
Have both Medicare, A and B, and Medicaid, and we try to guide those people to get the services that they need. A lot of people don't realize that they qualify. So I always tell people to make sure they call me, or if they have an organization that we work with, with a lot of partner organizations that have no idea of how to access services, they either call me directly. I have my cell phone, and again, it's great for referrals, but we're also helping people. I feel that every day I did my good deed.
Yes.
The idea is to sleep good at night and knowing that we did, because we care, we're empathetic, that's why I love working for Gateway. They have everything necessary to care for the whole person. And that's kind of our new motto, our new logo is to care for the whole person. And
Okay.
I look forward for many years to come, hopefully to do that and help people. There's a lot of older people. When my mom was alive, it's funny, she had Gateway. I was not with Gateway at the time. And before she passed, Gateway was always there. And I decided, let's go for it. Let's try. Because I worked with a different company before. And I
I
was
see.
very proud of that. And again, it was funny because they asked me 2 days ago to participate, and I'm like, sure, why not? Especially with Dr. Dominic O'Reilly. I've met her a couple times at some of the PLC conferences and things like that. And it's an honor to be here amongst the doctors such as Dr. O'Reilly. Thank you. We work with a lot of organizations like, Catholic Charities. We assist in by helping contributions that impact programs.
Yes.
There's a lot of programs out there that I've been working with one recently with the Housing Authority. It's called the Ross program, which identifies various needs in the communities. Neighborhood centers we work with, along with Gloria Velasquez, who's always promoting and participating in things in the community. And she always reaches out to me to see if we can help her, we can sponsor. We have over 28 counties that we serve, and we have all the providers. We have a lot of providers, so there's no issue as to access. We've been doing a lot of telephone, virtual meetings, things like that. A lot of our seniors don't have the technology, and I kind of walk them through it, help them out, set up appointments,
Right.
set up transportation, and anything that they may need. Gateway has the personnel to help them. We have clinical care managers. We have what's called prospective care management. We do a lot to make sure that the person's going to get what they need. Our members are going to get what they need.
And that's one of the best things about
sorry.
Gateway. Yeah, no, I'm sorry.
No, that's okay. I'm just a little nervous. I usually don't do a lot of these, but I'm getting used to it, and I'm really enjoying this because it looks like I'm reaching the right people. And some people didn't know. Some of the meetings that I've been to, they weren't aware of how Gateway was so committed to the communities. And we're getting that word out, and that's the important thing. That's the important thing.
Well, we're aware of it, and we appreciate Gateway. And I see that we have another young lady from Gateway that joined us this morning, Miss Marcia Martin, and we're glad to have her with us, and we appreciate Gateway's help. And that's part of what our network does, Cesar. It's what we do across the state. So we're glad to bring you into the fold and help you.
We have Roxanne. We have a new CEO, Kane Hayes, who has been very proactive in the way this company is going to be run. Very excited about his vision and where it's taken us right now. I know he's been doing a lot of interviews and things like that, supporting the commitment that Gateway has with the community, and that's one of the things that I like, that he is committed to making this company successful by participating, partnering with different organizations. He believes in that. That whole partnership is very important. So we're out there with open arms, just working with all the organizations that are out there that we can assist.
Great. Well, I'm sure, let's ask Ms. Jenkins the same question about Medicare, because I know you're very closely linked to AARP, and as a nurse and part of the Black Nurses Association, which I think is fabulous. I think that it's important that people know that, the work that you're doing, and maybe you can give folks some direction as well, that Cesar didn't cover in terms of Medicare, or, like he said, Catholic Charities. That's a great organization in and of itself as well. They do a lot of work. I know people that they have helped, so it's important work. I see some young people on here that might not quite be to the Medicare stage, but if you know someone and have a question, please send us your questions through the chat, and we'll be glad to ask these outstanding panelists. And then next we'll move to Dr. O. Maybe she can give us some information, not so much on Medicare, but I'd like her to give you an overview of her toolkit that she authored that, as she told me more and more about, I just became more and more impressed. But if you knew her, you would know that her heart is always making people healthy, taking care of people however she can. So if you would please, Ms. Jenkins, give us a little bit of information on what you're going to be working with and how we can get some help. And next we'll speak with Dr. O.
Okay, as far as Medicare goes, I really myself, I'm on Medicare, but and most of the people that I service and work with are on Medicare. So we're very sensitive to the information concerning Medicare. I'm always learning more and more. We have a population that not only has Medicare, but also Medicaid. So with those two entities, they are similar, but they're different as well. I just wanted to mention also that I'm a part of the Faith-Based Health Collaborative, the advisory board, and we service over 100 and some churches. So everything that we do, we bring back to the churches because we feel and we know that this is an area that we can reach more people at a shorter period of time. So we've done a lot in the communities, the churches as well. You know, sometimes people, and we have information that shows that people, that the aging population are more closely associated with their religion and with their churches, and they will listen to their pastor sometimes before they will their physician. So we found that to be very interesting. So we try to get as much information, medical information, out to the churches as possible so that they can relay it to the congregation. We do realize that there's many of them that are not back in session, and we know that this is another barrier that we found in the communities, especially in communities of color, that the information is very sporadic, because if they don't have access to either a cell phone, a smartphone, or if they don't have the technology for a computer or a tablet, these are some of the issues that we're working on so that we can disseminate the information more effectively in the communities. As far as the technology goes, this is something that we in the legislation is working on very effective. We're trying to get this information so that maybe we can get some monies available to provide this to the senior population who are on Medicare or Medicaid as well. So this is a real issue that we're trying to address as well.
Yes, I'm glad to hear that. And I'm glad to know about the faith-based information. That is something that I think you're right in terms of how we reach our populations. It's a wealth of information. We can, even if you don't go to church, if you post things at church, families can take things home. And so that's very helpful. And in our church, we've been doing it online as well. And apparently we spoke with our pastor the other day. We go to an AME church. We will be on virtual calls for quite some time yet to come because of the COVID. So that's very important. Thank you.
Thank you.
Dr. O, would you like to tell us about your toolkit and the great work that you've been doing to help us with our diabetes and our high blood pressure and some of the issues that we have in our communities? Thank you for coming today.
Well, thank you, Roxanne and Luther, the entire Talk Magazine family, and I am very proud to be here on this panel. My panelists are dynamic. They are game changers, movers and shakers out in the community.
That's right.
And so I'm very happy to be part, again, of the Talk Magazine family.
Thank you.
Back in, I would say 5 months ago, on March the 6th, we had our very first case of COVID here in Pennsylvania. We had 1 case. Today, we find ourselves on Saturday, the 25th of July. And if you look back at these data, or data that exists that's been collected over time from the start of the pandemic here in Pennsylvania, we have 2 stories to tell. The first one is that we've got this. When it comes to this, I'm talking about the data that can help inform our next steps and what we can do today. And today, we could say that we are okay from the perspective is that we are now 4 or 5 months into the pandemic, and you and I are alive, we're breathing, we are here. And at the same time, we also know that there is capacity in our hospitals that can continue to help mitigate the COVID-19 impact. We also have capacity for protective equipment, personal protective equipment. We have capacity for medical countermeasures is what they're called. We can say that story today because we have learned a lot over these past few days. The second story is the other one that deals with racial and ethnic minorities and the general population. In order for COVID-19 to have an impact on us, rather it be in our own home, at our school, community, at our workplace, the virus must enter the body. And as it enters the body, the Center for Disease Control has really provided the science that says that it is most likely to enter through the eyes, the nose, or the mouth. So one of the recommendations that you have heard is please protect these vulnerable areas. Wear a mask that protects you from touching your nose and your mouth. If you have glasses, Roxanne, you already have an added protective layer before you touch your eyes. You have to remove your glasses, right? But the bottom part is that this virus can do harm. It has done harm. It has taken lives unnecessarily. It has created impact and devastation and disruption on all aspects of life, our economy system, our every system we can think of. But on the flip side, it is a virus that must enter the body. And this is why it becomes so important that we protect our bodies, where we keep our social distancing, that in the event someone does have it, either they know it or they are asymptomatic. If they are at least 6 feet away from you, that virus is less likely to enter your body per se, from that perspective. And I know we don't know everything yet, but we do know enough on how to protect yourself. And that is what the toolkit had in mind. There's so much information. Sometimes it is just flooded down where there's so much that's said. But when it comes to a need, everything disappears. And what really matters is, how do I protect myself? And oh my goodness, how do I protect my loved one? Or, oh my goodness, I was just a first responder working at the restaurant, working in the hospitals, working for the essentials, and I'm exposed. What do I do then? So the toolkit was designed for four perspectives. Number one, to give you accurate information, to give you evidence-based information,
right,
to make it in real time. This is a fast and rapidly changing situation. The Center for Disease Control, the Department of Health, as well as our leaders, they are closely tracking and monitoring this situation. And we can visit their websites to get daily updates, which is what I encourage everyone to do. But as we learn that things are changing, it's important to have real-time information so that we could do the right thing at the right time and have the right COVID-19 mitigation. So the toolkit also gives you the opportunity to have the information you need in real time. Another aspect is it gives you 2 types of resources. It gives you human resources and it gives you technological, digital resources. The human resources is sometimes, Roxanne and others, we might have a question and we want to ask a doctor. We really have, there might be some situation, some scenario, it's a personalized issue, and we need to ask a healthcare professional. In the toolkit, through the efforts of Jean Langridge and the other 9 co-authors, there is a 1-800 or toll-free number, 24/7, Ask a Doctor. That is the human component of a pandemic that's needed. We embedded that in the toolkit. It is anyone can call, and it's no cost at all. If you have a question, ask a doctor, ask a provider, and the information is in the toolkit. The second thing that we have are really things that are called resources that are digital. These are also all of the helplines. Every situation is different. Some individuals may need unemployment assistance. Some individuals might need, you name it. Every scenario is different, from the school setting, the work setting, community setting, your home setting. In this toolkit, we provided helplines, crisis helplines. We have also one for the Department of Health. They have one that you can text, you can call, you can even get online. And there are so many individuals that may need some behavioral health interventions. There may be increases, as everyone knows, there's increases in suicides, increases in depression, increases in divorce rates. There's increasing even in taking advantage of vulnerable situations where there is also fraud and abuse and scams. So we have captured most every situation we could think of, and we provided the resources, both human resources, there are numbers you can call, and there's also digital numbers that in the event you want to use the technologies that we have and leverage those, you could also access what you need. From a business perspective, you are reopening, and there are protocols in place. What do you need to keep your employees safe? What do you need them to be able to stay resilient, safe, and open? There's also resources in the plan for businesses. If you are an individual that is seeking for a plan for your own home, how do you protect your home from COVID-19? There is a prevention plan embedded in there, and it gives you step-by-step what to do. There's also a treatment plan. I know there's no treatment for COVID, but there is some what they call self-treatment, that they will have an individual that is positive with COVID and say, go and self-treat at home. Well, now you have treatment at home. You're treating yourself at home. What do you need to treat COVID-19 for yourself or a loved one? That's also in the toolkit. It also tells you if you are there by yourself, what to do. There are helplines. If there are these situations where it is multi-generational or multiple families living in one dwelling or one household, how do you protect them from getting and spreading COVID should they be caring for a loved one? So we have situations, again, for your home, for your workplace, for your school, your community, and we have the accurate information that is in real time, and we give you that information in 2 ways. Straight from the source, which is directly linked to the Center for Disease Control and the Pennsylvania Department of Health. It also goes to our specialty societies where we have 1-800 numbers for everything from applying for food or getting food, shelter, help with insurance, help with other scenarios in terms of not just asking questions, but applying for questions. And applying for help. And that's also in there. So there is 7 or 8 different categories that address social determinants of health. So in the toolkit, you will see COVID and money, COVID and access to healthcare, COVID and access to testing. You'll also see there COVID and reopening, both at the state and the national level. It'll also give you COVID and employers, COVID and educators, COVID and parents, COVID and teachers. I think you get the idea. We thought of every scenario, at least under the sun. And again, it was a collaborative effort. I really do thank Dr. Eugene Langridge, who was able to be part of co-authoring this toolkit with us. But we also have 9 different community leaders that provided access and resources for everything from legal and health law to providing what you need to know to apply for assistance, both for small business association businesses, how to apply for your programming. There's many individuals that are practicing in the state of Pennsylvania. Some of them are licenses and licensures, and there's also an entire section there, how to renew your license if it's up for renewal during a pandemic. Driver's license, your vehicle inspection, and what do we call it when there's the plate inspections? What do we call those?
Oh, that's
We know it's
the,
license and plate. I guess it would call it your car, your vehicle registration. There you go.
Yes.
Yeah, your vehicle registration.
I don't know.
But there are things that you need. How do you renew your license?
Oh,
How do you renew so forth? And in that toolkit, we also have a section about important documents. Many of us have a special place that we keep our birth certificates, we keep our every password that we have for every account, from a retirement account to our Facebook account.
Yes.
But during a pandemic, when someone is in need, they end up at the hospital, they may need to make reference to those documents. And we always want to enter a hospital and exit the hospital. We entered live and we want to leave living, right?
That's
but
right.
in the event that, and we want it very short, maybe a day or two, get us out of there, right? Get us back into health. But sometimes with COVID-19, we're learning that if they do have severe symptoms, they may stay there more than a day, might be more than a week. And those documents, then someone needs to have access to them, and they need to know where to find them, or you yourself may need to. So it's important to also find a safeguard. Where do you put your important private information should you need to access it? And everything from your will to your, even if there has to be paid things like house payments and electricity payments and whatever that really has the daily operations of your household, keep those documents together in one local place. So in a nutshell, the toolkit is free of charge. Everyone that authored it did this just as a service to the community. There's no charge. We made it public domain so that you can have it, you can use it, you can share it. And when they say share it, it also means you can post it on any social media. You could post it, even send it to your mass distribution lists. It is yours. Basically, the whole goal was to keep yourself, myself, ourselves safe and healthy during a pandemic, but to remain resilient, that we are able to get through this if we just practice our COVID-19 mitigation efforts that have been so nicely put in there. And Roxanne, you highlighted those in the beginning of the conference. And again, washing your hands frequently, washing your hands. And Dr. Johnson always has a real good delivery message. And she reminds us that when you wash your hands, it's important to do it for at least 20 seconds. That's how much time of exposure the soap needs to kill the virus if it's on your hands. And to make sure also that you avoid touching your eyes, your nose, and your mouth. And that you also continue to go forward and practice social distancing. It doesn't mean isolation, because isolation means you're alone. The toolkit sends one strong message: you're not alone. There's help. We are here. And we've captured individuals that have representation and outreach and presence in all 67 counties in Pennsylvania. We are here to help. We have Caesar. We have
Yes.
Miss Jenkins as well. We have so many around us that we're ready to help you. The only thing that we do need is for us to remain united, for us to remember that these are unprecedented times. We don't have the answers for everything. We are learning, but we have each other. And that is the strongest piece of information that someone needs, is that we are here for each other. And there's that component of social support. That's embedded in the toolkit. If you somehow want to have information, there's a one-pager in that toolkit that you can print, just that one page. And you can say, here are the resources. We put the lifelines on there. We put the crisis line from the Department of Health. We put the Penn State Ask Your Doctor. We also put there the recommendations as presented by the Department of Health and the Center for Disease Control. And there's a space there. If you feel comfortable, you say, you can call me. I can guide you in areas that you need. I may not have all the answers. I certainly don't have all the resources, but I know where the resources are. And here they are. And that one little piece of paper you could put, and Roxanne, and I provide whatever you need. I am here for what I can help you with. Social support comes in many forms. It's not just money. Many of us, every household is limited with money, especially during a pandemic. But we are not limited with sending the message that we are here, we care about you, and you're not alone. And these are the resources. Do you have a question? Call the doctor. You need these helplines? Here they are.
Yes.
Do you need to apply for assistance, for housing assistance, food assistance, medical assistance, anything that you need that the services have been provided and resources? Here's the number. This is how you do it. We can do that. And all of us have already demonstrated that we're able to flatten the curve where it didn't really knock us out as we had thought that maybe you and I would not even made it past March. So we are here. And the good news is that this virus can be prevented. We have to just do an extra job of reminding ourselves, let's do our best so it doesn't enter our body knowingly. And washing our hands, keeping our distance, avoid touching your face and your mouth. And you will hear two things: respiratory hygiene and hygiene. There's also something that is called oral health. And it appears that racial and ethnic minorities are visiting the dentist on an emergency basis, and it usually results in teeth extraction. Teeth extraction is not the same thing as a teeth cleaning or as a cavity. Extraction means the tooth is out. And some of these extractions are happening at a pretty young age too. And it's happening a lot more in individuals that have underlying conditions. So protecting your eyes, your nose, your mouth, your teeth, your whole body is important. That is what's making it difficult during a pandemic. The virus doesn't care if we're racial, ethnic minorities or not. It's at everybody's door. But the difference is, why is it so difficult for racial and ethnic minorities? Because many of them have underlying conditions: diabetes, hypertension, cardiovascular disease, an unhealthy weight, and the sedentary lifestyles as well. And that is when the virus takes advantage of those situations and it increases the risks. So though these are disruptive times, unprecedented times that COVID has brought in, these are also times of opportunity. And the opportunity is for us to, for once, invest in our health, invest in our home, in our family, in our communities. And when you invest in your health, the first step is to see your doctor on a regular basis. And today you have not just in person in some practices, but you have telehealth and telemedicine, where technology has really been in our favor. And again, I'll just conclude by saying that we thank you for this opportunity. The kit is yours. Use it as you see fit, and allow yourself, your loved ones, your neighbors, your communities, stand and set the examples for others to follow. And let us be the success stories that say we know how to mitigate COVID-19. We know how to survive it. And we all have our stories to tell. We have the good, the bad, and the ugly, as we always say. Right. But we also have each other. And that's the beauty of it. So thank you so much for this opportunity. And I'll turn it back now to you.
Hi, I'm here. I had asked Sadiq to do something for me, but I'd like to interject, if I can, for one moment, a couple things. I did just hear from Mayor Peduto. He will not be able to join us this morning. He ran into a glitch in his schedule, but wishes us well, and he will see us on the next time, which is great. We appreciate that. Likewise, I'm having some trouble connecting to get Fitzgerald in, so we'll keep moving, and as they can or cannot, we'll keep moving. So I see the chats coming through, and I was just finding out if everyone can see them. Clearly you can. I just wanted to highlight a couple things. There's been a couple questions on the toolkit. So Dr. O has sent that to me, and I will be able to send it out to anyone that I have that wants it. Having said that, though, is there a website or somewhere they can go to download it or something like that as well?
There are, I believe currently there's 45 churches in Central PA that have it posted on their websites. It's also at the Penn State website. There are the Department of Health of the Cancer Prevention and Control Arm. They've also put it through their stakeholders website. I have not created an official website for it, because what I would like to do is give the toolkit to the community, to you, so that individuals then could also remember that you exist and that you are part of the community, and that's it. But what we do is give you the link, and you can share it. So if you put it on the Talk Magazine access, they can go and get it there. It's one thing that the toolkit has is 0 advertisements and 0 ownership. It lists the authors, but with the intention is public domain. It is yours to give, freely received and freely given. I will also add that there are opportunities to, within the toolkit, to reach out to better manage underlying conditions. So know your numbers is what's normally referenced, for example, managing diabetes. Know your numbers. Right now, they're also asking you to please reach out to your physician and your provider, learn what ways to lower your risk of COVID-19. Ask what can you do to better manage any underlying conditions should you have diabetes, cancer, heart disease, asthma, COPD, or anything that you can lower your risks for any of these diseases that COVID-19 is going after a little harder. And also nutrition. There's a toxicologist and epidemiologist out of the Department of Health. His name is Michael McCaskill, and he gave a presentation and talked about the importance of vitamin D. Now, there's no evidence that says vitamin D prevents or treats COVID-19. But there is evidence that say that anytime there's deficiencies of a vitamin or a mineral or anything with a nutrition, it does tend to create a little window where it could give you a more difficult outcome, or a less than optimal outcome. Right. So when I heard that, I thought it was also important that when you speak to your doctors and your providers, see if there's a coordinated healthcare team that says, where can I get what I need for my nutrition needs, for my behavioral health needs, for all of my disease management, if someone already has it, or how to prevent those. So again, the toolkits will be available through Roxanne with the link. She'll give those directly, and you can post those anywhere you'd like and use them as you see appropriate.
Great, and I will do that. I will make sure that we get it for anyone that does not or is not familiar. Oh.
Dr. Aurelia, thank you for touching on that last piece. One of our questions in the chat was if you could address any of the preemptive ways to mitigate COVID-19 symptoms, not symptoms, but contracting COVID-19 on the front end. So if there's any health recommendations, lifestyle recommendations on that front that might make you more immune to contracting the disease.
In the toolkit, it does address nutrition. It does address underlying conditions. It addresses COVID and vulnerable populations, from LGBTQI to racial and ethnic, from Asian, Indian, Pacific Islanders, African Americans, rural populations, white Caucasians, by geography as well, for all 67 counties. So there is information in that toolkit. In terms of symptoms and checkers, there is a self-check where you can assess your symptoms through both calling the doctor and asking them directly. There's the 24/7 free number. There's also a self-checker that Center for Disease Control has put together. That's in the toolkit. You click on it, it takes you straight to the CDC site for that symptoms checker, for that self-checker, and it'll give you there the questions. It'll guide you step by step for the questions on your responses, and then at the end, that particular tool will tell you your risk for COVID-19 and what is their recommendation for your next step. Again, you're not talking or seeing a doctor. It's a self-checker that the CDC put together, so they do have a disclaimer that this does not replace medical advice, but those resources are in the toolkit. I want to, if there's anything that I have said today that I want you to remember, is that there is help, you're not alone, and there are resources that can help lower your risk of getting, spreading, or dying of COVID.
Great.
Can I just interject?
Yes, please.
There's so many questions here in the chat. I just want to address, let me just address a couple here. One is that Dr. Aurelia had mentioned nutrition. One of the things that our faith-based health collaborative has partnered with is the American Heart Association here in the Pittsburgh area. And we provide food distribution every week to various sites all over the city, all over Pittsburgh, and in other counties as well, Westmoreland County, another couple of counties as well. And this is through our faith-based health collaborative organization, actually, which was started by Highmark years ago, and we've continued that. But we provide boxes of vegetables and fruits to everybody. A lot of our aging population, the boxes are too numerous for them, so they share it with their other residents in their areas or with other people. And this is a way of making sure that their nutrition is at least up to standard. We provide resources available for them, not only for the fruits and vegetables, but also if there's a population that has small children or babies, we provide, there's a diapers that is distribution that's given as well. So we want to make sure that the nutrition standards are up to par. And this is one of the ways that we're doing that. The other thing is that you mentioned Dr. Johnson, Dr. Rhonda Johnson. She gives a daily blog or COVID information, update information, which is outstanding. I listen to I listen to it on a daily basis, and I gain so much information and knowledge from Dr. Johnson as well. And she has been just phenomenal on this COVID information. And I suggest that anyone can go on site and listen to her blog on Facebook, and it's always repeated. So if they miss it on one day, they can go back and listen to it. So I've caught up on a lot of them. The other thing is that, and this is very dear to my heart, I really am trying to be very, one of the questions from Cheryl was, has anyone in the session experienced COVID illness or death in their social circle?
Yes.
Well, myself and the president of this large chapter, AARP, it's located here in the Hill District, and we meet at Ebenezer Baptist Church, and one of our long-standing members, her funeral is sorry. Her funeral is going to be on Wednesday coming up, and I just had a long talk with her daughter yesterday, and we talk about this COVID. This COVID is real. Her mother had gone to the doctors, her regular PCP visit. She just wanted to have her checkup. You know, we're always saying to make sure you keep in contact with your doctor. And she did. And when she went to the doctor's office, the doctor said, forgive me, I'm trying to get through this.
I understand. We all understand, yes. Hold on.
So the doctor said to her, he said, you're going to have to go to the emergency room now. So she said, why? She said, I'm okay. I'm feeling okay. The doctor said, well, I think that you have walking pneumonia. So if anybody knows about walking pneumonia, oftentimes your symptoms are not as pronounced. You have, you may have a little chest tightness, you may have maybe a cough, maybe not, but your symptoms are not as pronounced. So anyhow, they sent her directly from the office to the emergency room. She was admitted in the emergency room. They immediately put her on life support. And she couldn't understand. She couldn't understand why. They put her on oxygen. She didn't think that she had a problem breathing. So just to make a long story short, what happened was that they put her on the oxygen. Then they intubated her. They put her on the respirator. And from that point on, she went downhill. She died within 5 days.
Wow.
Now, someone who walks into the doctor's office, apparently she thought she was okay. And when they tested her, she was positive for COVID. So when I say that this thing is real, it is real. We must, and I can't express this enough, we must practice social distancing. We must wear our mask. We must wash our hands, not only our hands, but we must sanitize things that we may touch. It has to be, we have to do this because this virus is not playing. This is just one incident. And this girl I went to a funeral, memorial service. They're not even able to even have the kind of funerals that we're accustomed to.
Yeah.
Some of them are done virtually, and some of them are done. I went to a memorial service. This young lady was not even, her mother was a friend of mine. She was a member of my chapter as well. She wasn't even, her daughter came from Atlanta. She wasn't even able to prepare her mother for the kind of burial that we're accustomed to. As a matter of fact, as far as flowers, I mean, this is something that's very simple, but they're not even accepting flowers at certain, funerals now. This COVID has stopped so many things. And the memorial service I went to, she only could have 15 people. And the 15 people that she had there, only had 2 people at a table. Everybody was social distancing. Everybody wore a mask. And, we always have a repast after. It was a box lunch to go. You couldn't even sit and talk or anything. And the service was like 15 minutes or maybe even less than that. So that's what I'm saying. The reality is hitting all of us, even if it's not a personal attack, it's someone that you may know. In our churches, we've seen so many people that have passed or passing from this COVID as well. And this is why we have, and this is one of the larger organizations that we all have social contact with. And this is something that is very near and dear to my heart as well, concerning people getting together and being in proximity to each other. But we have to remember that distances that we have to practice. We have to do that. The other thing too, and I want to make sure that everybody knows, the Heart Association says, don't die of doubt. And what that means is that if you think you even have a possibility that you're having any type of symptoms, such as maybe a tightness in your chest, a cough that won't go, pain anywhere in your body, call 911. Do not wait. Do not doubt. We have aging population that are fearful. They're not going to their doctor's appointments. We have people that have had broken limbs and broken parts of their bodies, and they won't even go to see a physician because they're afraid to go in the hospitals. They're afraid that they're going to catch the virus. They're afraid to go. And sometimes the telemedicine, they want to see a doctor or they want to see a healthcare provider, but they're afraid. We have caregivers that are afraid to have people come into their homes to care for people. We have that. That's a real situation here. It's a real problem. We had a caregiver come into a home, 5 people got COVID. 3 of them died. We just buried them 2 weeks ago. This is in the community. These things are actually happening. And you mentioned testing. I don't want to take up too much time, but that's another thing. I'm getting a lot of questions about testing. How can we get people tested for this virus? We have so many places where people can go to get testing. One of the problems that I have is that some of the people that I service, the aging population, there may be testing sites available, but how do they access them? Sometimes they cannot get out of their apartments. If they have to use public transportation, they don't want to do that because of the COVID. If they have to use access does not wait for people. They take them, they drop them off, they have to wait for them to come back and pick them up. Well, these are some of the things, some of the issues that we're trying to address as well, because that's a real concern. The testing sites are available. The federal qualified health centers are testing people. We have people that they can call the Allegheny County Health Department to see where the testings are being done. Our faith-based health collaborative website, it's faithbhc.org, is we post our testing sites on a weekly basis to let people know where they're located. Some of the testing sites you need an appointment and others don't. Some are free. You can walk in, give your name and your email address, and they will send you your results. And some of them you need an appointment. You have to call for an appointment. But there's so many that are available, but we have to know where the resources are. So this is how we try to get the information out, by providing the resources that are available. As Dr. Aurelia had just mentioned, there are many places available, but we have to have the knowledge to know where.
Well, that could, if I may ask, and as I was thinking about it when you said that, forgive me for interrupting, but I just want to make sure I ask this question. I could put it in the chat, but can everybody hear me? I just want to make sure. Okay, so if you would please, Ms. Jenkins, the website, any websites that you want, please put them in the chat for us. I see young lady put the actual link in the chat already. I'm like, wow, how'd she do that so fast? For the for the toolkit. So that is actually in the chat. And I will use that and I will get that out to everybody. And if you would share your information, your contact information with us so we can make sure that you are in the Tmag family network. We can come directly to you. And if there is a drop-down box, you can share it with everyone, or you can share it privately with just me. That's fine as well if you don't want to share it with everybody. But we would certainly appreciate having your direct contact and make sure that we keep this family growing and bring in some new people. I see lots of new faces. I'm so glad. And we welcome everyone. So we got 15 minutes left. I'm trying to look through to see, maybe I could ask Sadiq to see if the questions in the chat room have been answered. What do you think?
Good. Roxanne, if I may,
Oh, yes, sir.
this is Caesar again.
Certainly.
Sorry to,
Yes, sir.
don't mean to interrupt. I just was piggybacking off of what Elaine was saying and what a lot of Dr. Aurelia was saying. Again, I'm here to talk about pretty much everything we can do to help. Want to be a part of this, and we're always on top of contacting our members, making sure that they're okay. Again, just being a resource for them. We're on top of this with the COVID. We send out letters. We reach out to our members, making sure that they can depend on us for anything that they may need. One of the things is, again, the isolation. I've been in different organizations different meetings where we're trying to see how we can probably get some kind of help to get them groceries, non-perishable goods, things like that. I know we're not allowed to go into some of the buildings, some of the senior high rises, but we are putting care packages together and give them to, let's say, the tenant council president or
Right,
something
exactly.
they can hand out so that we're not physically there, but we're always there for them. Another barrier is, again, you know, it's the language barrier. Again, it's a big thing. The accessibility to care. Me being bilingual, it's easy. They call me,
Sure.
and I'm able to help. And it's again, it's something I feel great about. But there is that factor out there that Gateway is being proactive with this whole COVID situation. It's unfortunate, but we're there to assist. I get calls all the time. I've been with Gateway almost 9 years, and I personally have about 1,500 people that are members that I've signed up, and I get a call every once in a while. Just somebody call, say hello, or what's new, or what can we, you know, how can I access this, or you know, transportation is a big thing.
Sure.
So again, we are being proactive, and we care for the whole person, and that's the important thing.
Well, you know, I saw a news a couple days ago, a news piece about a man who delivered newspapers. And one day he got a note asking if he could put the newspaper closer to the front door because the seniors that lived there couldn't walk the end of the driveway. It would be helpful to get, you know, to have it at closer to the door. And it gave him an idea, and it has blossomed and grown. He put in the newspapers his name and number and who he was, and asked if any of the seniors needed help with shopping that he could help them with. And now he's actually grown this into an organization because he has so many people respond that he needed help to actually get out that information. So it's something, you know, like you said, it's the health of everyone mentally, and letting people know they're not alone. And it's a horrific way to have to be sick where you are alone. You don't know anybody. You're looking at these people that are in all this, you know, gear. You can't even see their face, and they're standing over top of you. It can be frightening, I would imagine. So I think that what you're saying is absolutely right. I said the story about the man because it's so important, little things that we can do, even if it doesn't grow and prosper, even if it's just your neighbor or somebody from your church, or you know, somebody from your church family's family. It's just really important that we extend ourselves to each other and help. I think that's a healthy way to live. It helps you feel good when you help others, and it helps that person. So I think that's very important. I see a lot of chat coming through. This is great. I'm trying to see if I can see any questions. So yeah, I was going to ask as well, Mr. Sadiq, if you would like to jump in.
For our panelists, along the lines of the question surrounding community testing facility, is there a distinction that needs to be made between facilities that give you a prescription or sign notice from your PCP versus those that you can just walk into? Arises.
Your audio is a little mumbled, Sadiq, a little bit off and on.
Hey, can you hear me?
That's better.
Okay, all right, thank you. I think that the concern surrounding whether or what the process is if you do not have a PCP or if you do not have health insurance, and whether services are still going to be made available to you. So I just wanted to know if you all could speak to that.
So you were muted, but you mentioned health insurance, and that's what I do. So, can you hear me?
Yes.
Okay. I'm sorry, I didn't get the end of that question, but as far as getting health insurance, again, I work for Gateway, rallies with Highmark, and they're actually one company. Let's say, let's say Gateway is owned by Highmark. So as far as I understand, a lot of people don't know how to access healthcare. especially not being able to go out. They're getting a lot of phone calls from people trying to sell them this or trying to sell them that. It's very hard. It's confusing, first of all, and they need to feel that trust, you know, and Gateway gives them that trust. I mean, we're out there answering questions. We're out there um, taking care of their needs. I mean, when somebody calls me with a problem, we try to take care of it. We try to nip it right from the beginning. But just the fact that some people don't know how to access it. It's as simple as giving us a phone call. We find out your eligibility. We find out if you have Medicare. If some people have it, don't realize they have it. The same as Medicaid. You ask them, do you have Medicaid? Oh, we don't know. I'm not sure. They may have partial and don't know it. So I'm able to get to that specific, that person's eligibility. I'm sorry, I'm a little nervous. Get their eligibility and make sure that I point them in the right direction. Okay, so if they're able to sign up with Gateway, I'm happy to sign up with them, especially with this COVID thing. We're allowed to sign them up electronically. We don't have to go to their homes unless they want to, of course. We had one of our team members the other day go out to a home, wore a mask. They were 6 feet apart, and it was a successful application. But again, we are here to assist. You know, we get their eligibility and put them on the right track. Make sure that they get all the services they need, services that they didn't know they qualified for. Some people don't know that they qualify for extra benefits, such as the state paying for their Part B premium, let's say. I had a gentleman one time, I would always see him in the areas, the senior high rises, and he never wanted to talk to me until one day it was raining. And I said, that's a perfect opportunity. He asked me if I could take him to the beer distributor to buy a case of beer. And I said, well, why not? This is my opportunity to talk to him. Got him to get the state to pay for his Part B. He was excited. And I said, you should have listened to me months ago. And now he asked me to go get him 2 cases of beer, which is, you know, now he had more money to do so. But anyway, it feels great that I'm backed up by the company that does that helps us get our population, our community, what they need. Services they need, pretty much anything they need. We have the Life Alert. We have gym memberships. We have, for people with chronic conditions, we provide the vacuum cleaners. We provide air purifiers. You know, a lot of things that aren't in, let's say, a normal benefit package, but we do provide a lot of good benefits. So people just need to be informed, and you know, we're here to help. We're here to help.
Can I just interject that this is going to be, it's been predicted by the medical profession that everyone should have a flu shot. The importance of getting a flu shot vaccination this season is going to be critical. That's one of the other things that I do. We go into various areas. We go to schools, we go to organizations, we go to high rises, we go to lawyers' buildings, we go to different places with the company that I work with, and we provide vaccinations for everybody. They don't have to leave their place of employment. We come to them. It's like a mobile vaccination clinic that I do, that we set up. So the importance, there's all the physicians, the medical profession is saying the importance of a flu vaccine being given this season. It's going to be critical. We're not only fighting the flu the flu season, but we're also fighting the COVID-19 virus as well. So with that in mind, it's important. And I know some people don't like to get flu shots, but it's a dead virus. It's not a live virus. And we get questions about, so I got the flu vaccine, and I got the flu. Well, that's been addressed on numerous occasions. Years ago, it used to be the live virus, okay? And that could be a possibility, but now it's a dead virus. If you get the flu, even though you've had the vaccine, you will not have your symptoms as bad. Your symptoms will not be as bad. So it's important to remember that. Please get your flu vaccine. And I don't know when the other vaccine for this virus is going to take place. You know, this is a process. I have a 30-year history with a major pharmaceutical company, so I know the process of how everything comes to market. It doesn't come overnight. There has to be a lot of things that have to take place before a vaccine for COVID is on the market. So just to keep those things in mind, please get your flu shot. It's critical this season.
Yes, I would think that that is. So we are just about to run out of time here for our first group of speakers. You know, I've always said panelists. We've always had this set up in a room and we all sit together and talk together, and it's all like on a nice dais and panel. But I have to get used to now saying speakers and guests, and that's great. So that's I'm enjoying. I'm learning. I'm still bopping around, and I apologize. I do have to leave once in a while and get a couple other things, but I look forward to doing this again, actually, now that I'm in it. So thank you all for coming. Thank you, our health care panel. I've learned a lot today. And the chat, I will have the information from the chat. And I see some people are putting in their contact information, which is great. So we can make sure that this information is available too. Once we get some of these critical numbers and email addresses and websites and links, we'll make sure that that's available. I may even think, and you guys can tell me what you think about this in the chat. I won't put this in the survey, but I'll ask now. You know, we can go on Talk Magazine's website, and as we develop Tmag's website, which should be up soon, we will add a link or a tab, I guess it's called, on the website, and we will ask people to give us their information, and as we get it, we'll put in a COVID or a healthcare link, healthcare tab, and people can access resources there as well. So thank you again, everyone, on our panel. We'll get ready to switch out these wonderful folks with the next group, and I'll try to manage that while Mr. Sadiq lets us know who's going to join us next in the housing, if you would please, sir. Thank you. And thank you all again for joining us.
Thank you, Roxanne.
Thank you so much.
Thank you.
Appreciate it. Be well, be blessed,
Be well.
and
You
be
too.
safe.
Be
And watch
well.
the hands too. Take care. Bye-bye.
Right. Bye-bye.
Doctor.
All right, as we enter our second conversation here, we will be joined by Ali Tomich,
Oops.
Director of the Western Region of Pennsylvania Housing Finance Agency, Ms. Beverly Moore, Deputy Executive Director of the Allegheny County Housing Authority, Castor Binion, Executive Director of the Housing Authority for the City of Pittsburgh, and Ms. Diamante Walker, Deputy Executive Director of the Urban Redevelopment Authority of Pittsburgh. Thank you all for joining us here today. Similarly to our first session, if you all wouldn't mind kind of inundating us to the work that your organization participates in, as well as your role within the organization, and maybe some of your inspirations and triumphs as we move through these turbulent times.
Can you hear me? I'm trying to find our panelists as we go. I found Miss Diamante Walker and I found Miss Beverly Moore, and I would ask her to unmute, and I'm going to spotlight her as well. And I'm learning how to do this a little quicker. Oh, there's Miss Allie. Hello. We can ask you, the panelists, to unmute yourselves and start your video. And let's see, who else am I missing? Sadiq, who
Yes.
am I missing? We got Diamante.
Unmuting Ally.
Morning.
Okay, good morning. Welcome.
Thank you for having me.
Oh, absolutely. Yes, ma'am. And our good friend, Ms. Beverly Moore, is here with us. Thank you for coming. Did I get you, Ally? No? Okay, let me see if I did something. Okay, we'll work on that. I need to get Castor. Do I see Castor? Is he with us?
No, I'm not seeing Castor on the call just yet.
Okay.
But
Well,
Ms. Moore, if you wouldn't mind starting us off.
I don't mind at all. Good morning to everybody. And I want to thank Luther and Roxanne for just having this type of forum, and especially at a time like this, because we actually need this. I was excited when I found out that you were actually going to keep going forward to bring information to the folk. And this is something that we actually do need. So thank you. Well, I want to start off. Number one, I am the Deputy Executive Director for the Allegheny County Housing Authority. I grew up in the housing industry, meaning that I've been working all my life, it seems, young life to now, for the housing authorities. And so in the Allegheny County Housing Authority, I have an opportunity to really be able to work sometimes hand in hand with a lot of our resident councils and naturally with the staff and all. And through the COVID times, we found that we really have an awful lot of misunderstandings that are out there when it comes to what happens when you have to or not have to pay rent. And one of those misunderstandings is that we have a lot of folk that somehow got information that they did not have to pay rent during the COVID times, and that is absolutely not true. So much so that HUD decided to send out a flyer that would let everyone know that the rent is still due and they are still responsible for paying their rent. But what has happened to help residents who are falling into difficulty is that we have moratoriums that have been set on evictions, that you cannot be evicted during the COVID time. So if you have not paid your rent, we're not going to pursue eviction against you until after that moratorium time is lifted. So there's another misunderstanding as to what does that mean when you're looking at different dates of expiration for the moratorium. Where there was a date of July 10th, there is a date of July 24th, and there is a date of August 31st. So let me explain. The July 10th was Allegheny County's date. And that means that no magistrates, no courtrooms will be open to entertain any kind of eviction proceedings that would come through at that time. Allegheny County changed their date to August 31st, 2020. Well, that gives us a little more of a reprieve, which is good. HUD has always had July 24th, and they still have July 24th. But what HUD does is they always go along with and support the local moratorium date that the state has said. Right now, our state has said August 31st, and that is what we will honor. So that means that on August 31st, housing authorities, any landlords, not just housing authorities, are able to pursue eviction. So there is a fear at this point that there will be far too many families who will become homeless because of that. But I want to share with you, for the housing authority of Allegheny County, we have really 5 ways that you can pay rent. And since you're hearing now and have learned, because we put flyers and staff out to let you know, that there are 5 ways that you can actually pay your rent. So if you're behind in your rent and you find that you do have money and you need to get it in there so that you don't have to be concerned about going through eviction processes or being applied or being charged with those eviction fees, you can pay your rent through the lockbox system that everybody who lives in public housing will know that that's how you can do it. For those who live in Section 8, contact your landlords and let them know how it is that you actually will get your rent paid. Another way you can do it is that we have the credit card system that there's a fee for that, but it's worth it if it's saving your unit, that you can actually pay your rent through the phone. And on the phone, you have 2 ways. That's the credit card. And the other way is that you can pay directly from your savings or your checking account. And then we have online paying that you can go on our website and you can click on the tab that says that you can pay your rent, and then you can pay your rent online. And then we have another feature that a lot of people, especially our seniors, use this, and that's the direct deposit, direct debit payment. And the direct debit payment means that you have given us your bank information, and on the 5th of every month, we just go ahead and take your rent out. And then you don't have to worry about having to pay, even if you're on vacation, in the hospital, just don't want to be bothered, the rent will be paid. And those are the ways that you can actually pay your rent there. Now, the other thing that we've done because of COVID, and perhaps you have lost your job, or maybe you have less hours that you're working, we are allowing you to self-certify. That's public housing as well as Section 8. Go on our website. There is a form that you complete. Whether you're in public housing, you go to that form. If you're in Section 8, you go to that form. And then you can put on there exactly what has happened. You have either lost your job and you have less money or no money, or maybe you are on unemployment at this point. You can certify to that. And what we do is we'll get back to you within 72 hours and tell you, we'll adjust your rent accordingly so that you can actually pay your rent and not be stressed out over the fact that you've not been able to actually tell somebody, because our offices are closed. They will be closed through all of this. Although we're in our offices, we're not open to the public, but you can call any office. I've gotten many calls where folk have gone online and saw where my name is, and so they've called me. I try to get back to you because I realize that these are stressful times. So I want to let you know that we do have that. And let's say that you get to close to August 31st, and somehow you are still struggling and you are stressed out, that you might think that you're going to be going through that eviction process. I would encourage you right now to get to the management office. I wouldn't care if you went there in person, you put a note on the door, that somebody will get back to you. We will extend payment plan arrangements so that you are able to have some peace with the fact that you cannot right now get this. Not only that, we also have other ways that we can help you get your rent paid. I know Ali is on the call and she'll probably talk more about this, and so I want to allow her to do that. But they have a plan whereby we do have some people that have already applied for the plan that they have, where you can get your rent paid up to $750 a month for, I forget the number of months. So I'm glad Ali's on, and I would have to go through my paper and find out where it is on here. But that's one way that you can actually, you can apply right now for some assistance to get to pay your rent. We have other ways that you can get some help to pay your rent. And I think that that you're being contacted. If you're in the public housing side, you're being contacted by the service coordinators because they're working with you to connect you with agencies that will help you to pay your rent, including agencies like the welfare system. So I would encourage you, if you need more than what I'm talking about, I'm trying to talk fast. I know there are other people who are going to be speaking to these issues, but I do want you to know that we do not want to evict anybody. We want nobody homeless because of what we're going through. And so we are here to help you in every way that we can to make sure that your home is safe, your family is safe, and you are safe, and you are less stressed out because of all of this. So you can also get in touch with me. You can find me on the website. You can find my number like you can find everybody else's and call. I will make sure that you get connected to the people that need to get back to you, including our Section 8 people. I will make sure that they get back to you so that you get all the rest of your questions answered, and that you will not have to experience being out on the streets because of this. Now, I don't know whether I've talked past my time, but I do want to say one more thing. Gateway Healthcare System has done something for our housing authority that I think is absolutely wonderful. We did an outreach to them and said we have far too many people who are still in isolation, and they are lonely and they are depressed at this point. And so they gave us a grant. What we're going to be doing with this grant is reaching out to our seniors and providing for them what I've learned now. I didn't realize they came with screens at this point. We're going to do an echo screen or Alexa screen for them, and there's like a little buddy system that comes with that they are really connected to even their next door neighbor if necessary. We have so many folks that are really afraid to even go grocery shopping. So I'm glad to hear that Gateway Health will help with that. And so I want to say thank you to them and to let you know what they've done, because we really are appreciative of what they've done. So if I've talked up all my time, I'll stop. If not talked up all my time, I'll keep on going. Let me know, Roxanne, please.
I'm sorry. Yes, I'm sorry, I'm trying to do some behind the scenes things as well. So nope, I heard most of that, and that was good information. Thank you very much.
Good.
So we have, I see Castor Binion has joined the group, and want to thank him and appreciate the sponsorship as well. They are one of our sponsors, and we are glad to have him here with us. Diamante is with us, and I saw Allie. I'm not sure if it's me. I've tried to let her in, and I've asked her to unmute.
Can you hear me?
Oh, good. I can hear you. Thank you. Okay.
You're welcome.
Okay, I wasn't sure if you could hear us. So let's proceed. Well, okay, so one reason I was looking for you was because Elder Moore had mentioned you and a program with PHFA, Pennsylvania Housing Finance, for those that don't know the acronym, that Miss Allie Tomich works with. We'd like to give you an opportunity, Allie, to go ahead and respond to her mention and anything else you'd like to share with us. And then next, we would like to go to Castor Binion and Diamante Walker. So we can just get a quick overview of your organization, what you do, and hopefully we will have some. I see one question, there's a long one in the chat. So if you guys could look at the chat, it is to everybody. And we'll try to help, Sadiq and I will try to help verbalize the chat as well, if we think that we're going to miss a question, because we don't want people's questions to be missed. So having said that, yes, Miss Allie, if you would please, thanks for joining us, and let's share with the people what you've been up to. Thank you.
All right. Thank you so much, Roxanne. And I want to thank you and Luther for inviting PHFA to this very important forum. And I do want to say that I'm sure that our new director, Robin Weissman, We'll be
Yes.
looking forward to meeting with you and continuing the strong partnership PHFA has had with you under Brian Hudson's direction.
Thank you. You were hearing me earlier than I see, huh?
Yes, I
Yes.
was. Yes, I was.
Great.
So I was listening to all this good information. So
Great.
my name is Allie Tomich. I am the PHFA's director of our Western region. Which is located in Green Tree, right outside of Pittsburgh. My office covers the 26 counties of Western Pennsylvania. We also have our headquarters in Harrisburg, which employs approximately 300 people, and we have our Eastern region out in Philly. So for those of you who don't know what PHFA does, we provide funding for affordable home ownership and rental opportunities for older adults, low and moderate income families, persons with special housing needs, and veterans. We provide single family mortgages. We help construct affordable rental units. And since our inception in 1972, we have saved the homes of more than 50,000 families from foreclosure with our foreclosure prevention. We are not supported by public tax dollars. All of our programs and operations are funded by fees from our program users. So what I've been asked to talk to you about today is our CARES Rent Relief Program and Mortgage Assistance Program. So the Federal Coronavirus Aid, Relief, and Economic Security Act, that is what we call the CARES Act, provided $3.9 billion to Pennsylvania, and it was intended to help people hurt economically during the pandemic. So in May, the Pennsylvania General Assembly crafted legislation that directed $175 million of that money to PHFA to provide programs to provide rental assistance and mortgage assistance. And it is a form of a grant, so it means it doesn't have to be paid back. And both programs are for struggling renters and homeowners who have been impacted financially by the pandemic. So 150 million of that fund is set aside for rental assistance, and 25 million has been set aside for mortgage assistance. So before I go forward, I want to give everybody our PHFA website, because all of the information I'm going to talk about today is just the tip of the iceberg. There's so much additional information on our website. So that would be www.phfa.org. So when you go onto our website, our homepage, you'll see a bright red banner across the top, and it says CARES Assistance for Renters and Homeowners. And you click on the link right below that, and that will take you to both the rental assistance program applications as well as the mortgage assistance program applications. If you don't have a computer or don't have access to one, you can also contact our Customer Solutions Center. I'm going to give you our toll-free number. Our staff there is very well versed in all of these programs and will be very good at assisting you with any question you might have. So the toll-free number is 1-855-827-3466. I'll say that one more time. 1-855-827-3466. So what I'd like to do now is just go on and talk a little bit about each program. I'll start with the CARES Rent Relief Program. So this program was established to provide rental assistance to assist households experiencing a job loss or a substantial loss of income, and that would be at least 30% of your income or more as a result of COVID, and who are also at least 30 days past due on their monthly rental payments. Now, who can apply for this? Renters can apply themselves, or landlords who have lost income because a renter has experienced job loss can also apply on behalf of their tenants. So to qualify for this program, again, you have to document at least a 30% reduction in income since March 1st of this year, or you must have been unemployed and applied for unemployment anywhere between March 1st and actually at the end of the year upcoming. There is an income limit for this. The renter's income may not exceed whatever the area median income is for your particular county. And those income limits are on our website as well. But say, for example, Allegheny County, the maximum income limit for one person household is $58,100. If you have two persons in your household, it jumps up to $66,400 and so on. So again, those charts are on our website, or you call our Customer Solutions Center and they can assist you in finding those. What you can receive, as Bev had mentioned, is up to $750 a month per household for a 6-month period of time. And that 6 months will stretch from March 1st of this year all the way through the end of December. Payments are made directly to the landlord on behalf of the renter. We began accepting applications on July 6th, and you can apply all the way through the end of September of this year, September 30th. So how do you apply? For the rental assistance part, PHFA has partnered with one organization in each county who will process the applications. You will send the applications for them. And again, that list of county contacts is on our website. Allegheny County, for example, the Allegheny County Department of Economic Development is taking in and processing all of the rental applications for Allegheny County. And if you go onto our website for this contact list, you'll get the organization's name, address, phone number, website, email address. Let's see. Okay, I already talked about the deadline. What you need to do to apply is, again, what you need to do to apply, you would find out whoever your county contact is. You would go on to our PHFA website, or you can go on to your county contact website, and you can download our application. They can either be sent, you can download the application for your county and you can send it electronically, or you can send it by mail to the county contact. For renters, there are 3 forms, 2 that the landlord has to fill out and 1 that the lessee has to fill out. Now, if a landlord, let's say your rent is more than $750 a month. If your landlord accepts participation in this program, they also sign one of those forms that say they will not hold you accountable for the balance of your rent. So say your rent was $850. They would get the $750 and the additional $100 would be forgiven. You could not be evicted because you did not pay that. So that is a very, excuse me, a very important aspect of this. And again, that is one of the forms that the landlord has to fill out and attest to. One other issue, one other item I wanted to address is, for the rental part, please do not send your applications directly to PHFA. They have to go to the county contact, because these applications are being processed on a first come, first served basis. And if you send an application or mail them to PHFA, we have to then turn around and quickly try to send them to your county contact. And you have several days there where there's a lag between when you applied and when the county contact actually received it. So we want to make sure that that application gets to the county contact as soon as possible. And again, if you have any questions about who that contact might be, call our Customer Solutions Center. Any questions? Well, I guess the questions will be through chat, and I'll take questions on this afterwards. And then I want to move over to the Mortgage Assistance Program. So the Mortgage Assistance Program was created to aid in foreclosure prevention by providing emergency assistance in the form of a grant. Again, you don't have to pay it back, to homeowners who are at least 30 days delinquent in their monthly mortgage payments due strictly to loss of income or a loss of a job that is related to COVID. So homeowners can apply directly for this, or a lender, your lender can apply on behalf of the homeowner. The difference here is PHFA, these applications are coming directly to PHFA. So the county entities are handling the rent relief, PHFA is handling the mortgage assistance program. You can go onto our website and you can apply directly online and transmit your application directly to us, or you can download, print, copy, and mail it, whichever is easier for you. What you will receive on the mortgage assistance is up to $1,000 a month for a maximum of 6 months for a period between March 2020 to December of this year. Again, payments are made directly to your lender, and the lender must attest that if your mortgage is more than $1,000, then they will forgive that additional amount as long as they have been receiving money under our mortgage assistance program. I think that pretty much covers both of those programs. Again, when you do go onto our website and you click on that link, you will find it'll take you directly to both the rental assistance and the mortgage assistance program. If you're applying for rental assistance, again, you'll have the application there, you'll have the income limits, you'll have all the county contacts, you'll have frequently asked questions. There's a treasure load of information. And again, even if you do go onto our website and you don't understand something, please contact our Customer Solutions Center. And that's about it for the, I can wait for questions either now or later. The two other things that I was asked to talk about is how do you search for housing if you're looking for it? Well, we have an excellent free online service called pahousingsearch.com. There's no spaces there. And you can search for up-to-date listings on affordable rental and for sale homes. There are pictures of the properties. There are maps to show you where they are. You can search by the town or the county that you want to live in, what type of housing, if you're looking for senior housing, family housing, housing for special needs, if you have somebody disabled, veterans housing. There's a whole lot of different criteria you can search by. How many bedrooms? Do you need rental assistance? Does the landlord accept the voucher? And once you start your search and you start to pull up properties, you'll see photographs of the properties, photographs of the units that are vacant, what the rent is, what the income criteria is, or for the particular property. It's just an excellent, I think it's the best way and the easiest way to search for housing. PHFA requires every property that we fund to list their properties on this website. Housing authorities also list their properties, private owners, private landlords. So I would suggest that anybody looking for a property, you can go onto this website. Again, it's pahousingsearch.com, or I'm going to give you their toll-free number because their customer assistance is excellent. They're very patient. They will do the search for you while you're on the phone. So that number is 1-877-428-8844. And again, I will give this information to Roxanne to post. And finally, I was asked to talk about what type of help we have for purchasing a new home. And we have a myriad of housing programs, loan programs. And again, you can access these on our website. But we have very competitive rate mortgages for single family homes. We have loans for renovation and energy efficiency. We have closing cost and down payment assistance. We have free housing counseling, and just a myriad of other products that will be very helpful to you if you're in the process of looking for a home. And again, if you go onto our website, or if you call our Customer Solutions Center and you say, I really am looking to buy a house and I just don't know where to start, can you help connect me to someone? You will be connected immediately to someone in either a loan servicing or our home ownership division that'll be able to give you one-on-one help with that. Right now, since March, PHFA as a whole has been working remotely. However, we are fully operational. We do have some staff in-house in our loan in our loan servicing because they're handling the mortgage assistance program applications. But if you ever need one-on-one assistance, please feel free to call our Customer Solutions Center. And that's what I have for now. Thank you, Roxanne.
Oh, you're absolutely welcome. I appreciate that's a lot of information.
Yes.
And I see Sadiq has done a great job in putting some of the numbers and websites in there for us. And what we can do, excuse me, yes, if you, there's a question in there, I'm just going to ask Sadiq if he would address that question. If it's in the chat, it's a long one, and ask Castor Binion to give a brief overview or chat about what he does, and then we'll address this question about HUD. I guess you guys have all seen it. It's in the chat. I'm not sure who would be best to answer that. Thanks, Sadiq.
Hey, my name is Castor Binion. I'm the Executive Director of the Housing Authority of the City of Pittsburgh. Represent over 20,000 residents, 300 plus employees all across the city of Pittsburgh. We have conventional housing, mixed finance, scattered sites, and we also have home ownership program. But the home ownership, I'm going to pass that to Demonte. She get ready to talk because we work together as partners to provide housing to Pittsburgh.
That's great.
One of the things that my partner over at Allegheny County cover, mostly all the stuff that relate to housing projects and the stuff they are doing and we're doing. So I briefly will go down the list. And one thing that is what I call misinformation. Most people think that if you're in Section 8 of public housing, you lose your job, you're going to be stuck with your rent. However, if you're in Section 8 of public housing, or any of the housing programs that are sponsored by HUD, generally your income is how we determine your rent. Zero income is zero rent. If you lose your job, you immediately adjust your rent to your income. We also have hardship situations if you unable to pay the minimum rent, which is basically $25. We can't work with that $25 too. We are in the business of housing authority. We're in the business of housing people, and we really don't want anyone to be thinking that we in the business of evicting people. If a resident, even on this COVID-19, get evicted, I mean, it's kind of rough because with all the resources from PHFA to URA to foundations and other key resources that come from the state and other partners, it's all kind of money out there. We at the housing authorities, what we are doing, the HUD is not going to allow us, to pay people rent. At the same time, we can do communication and lines of communication of how residents can contact and access these resources to assist them with rent. Just real quick to let you know, for example, a resident rent is based upon annual income. And then based upon annual income for each child that they have, you subtract $430 for the child, $400 if you're disabled, and we take all your child care credits if the child care credit is is less than the income that you make. Here at the house in Pittsburgh, we are able to, reduce our residents' rents who was impacted by COVID-19. And we don't really anticipate a mass amount of evictions that would occur. We will anticipate that we probably in our 400 or 500 late notices and all of the stuff that you have to do prior to eviction. but actually when you get down to eviction, it's going to be a very low number. We do have some residents who are not paying their rent, but like I say, there are other resources, payment agreements, and other things to assist prior to us getting to the eviction part. Some of the things that we have done at Pittsburgh Housing Authority, as I said, we reduce rents. We have an eviction protection program. We partner with other resources. We have provide Pittsburgh Public School with tablets for the kids, and we have for every child who live in public housing, conventional public housing. Well, Section 8 too. Not Section 8, but scattered sites. We have provided them working with Comcast free internet, and we also are giving them tablets so that the kids will be able to continue their education because of PPS did not have enough resources to accommodate all students. And now the students will have the tablets and will have the capability to do work from home. And the seniors will have the capability to do video with their health providers, because if you know, they really don't want to see you in the office anymore. They want to see you on a video. We have basically eradicated families being hungry, working with 412. It's provider who provide food, meals, and we did all that during the COVID-19. We have provide masks. We clean and clean and clean like everybody else.
Yes. Yes.
We have worked with some partners who have went to our conventional developments and provide testing for COVID-19. That's been going very successful. Matter of fact, they coming back again a couple of times.
Wow. Wow.
And one program to increase landlords. And if you have a house in the city of Pittsburgh and you want to put it on the Section 8 program, if it's 1 or 3 bedroom, we will give you a bonus of $500. Then if it's 4, 5, 6 bed, 5, 6, I believe it, 4, 5, 6, we give you $1,000 bonus. And we're also doing assistance for security deposits. Residents, you know, they will basically need to come up with $99. It's generally for the Section 8 program. Section 8 landlords can charge up to 2 months for security deposit. Most of them do like this, probably about 30 days, but we are assisting residents come up with $99, and we will work with the landlord for the rest of it. The thing, like I said, with Gateway, we like working with Gateway because we have movie night. Movie night will be outside in the process of setting it up for the seniors. There's a whole lot of programs that if you under the umbrella, there is a whole lot of protection, right over and above than the regular populations of low-income people. We in Housing Authority and HUD, we want to let you know that our residents, you know, they are protected. You're in a safe environment. We have resources to assist, and everything seems like it's going very well. We only had one resident who came down with the COVID-19, and I believe she was, I think she was like 70 or 79 years old. She passed away. But outside of that, we've been COVID-free. Staff-wise, I think I may have one person. But I want to leave time for additional conversations for my partners. For the bottom line, if you're a resident under the HUD umbrella, it's all the protection in the world. Don't worry about us. But we do want you to worry about the rest of the population who do not have the resources and protection of HUD. Thank you.
Yes. Thank you. Diamante?
Okay. All right. Well, good morning. And I want to thank the partners here for sharing that information. I was listening and I can see that we have a lot of overlap and cooperation between our agencies. So
That's
Very
great.
thankful for the partnership of the other agencies on the phone today. And I'd like to thank the Sewells for having me to talk a little bit about what the
Absolutely.
URA has been doing with respect to COVID response and COVID intervention. As Castor said, I will talk a little bit about the homeownership program. And I do think that I may address Rainey Martin's question in my presentation. If I don't, then, I'm happy to, work together to figure out how to answer that question. So it's a lot of information that I'm going to share, and I see that we're almost at time, so I'm going to try to be as quick as possible here, but I am going to provide a link to the presentation that I'm talking through so that if folks want to follow along, they
Great.
will have that at their disposal.
I love
Um,
that, Diamante. You guys are so on top of things. Yeah, that's great.
I want to thank my team at the URA. They do a lot to build content so that when we have these kinds of opportunities, there are graphics and resources available to try to make it
Perfect.
easier because it's a lot to digest. So,
Yes,
so yeah,
that's great.
so I'm going to skip that. You guys, know me. I'm, the Deputy Executive Director of the Urban Redevelopment Authority, and I've been with the URA for about 3 years. I came in as the MWBE Program Officer, really looking at the agency's equitable business practices, and then that work started to migrate into some other areas, inclusive of affordable housing and equitable development. And so our affordable housing programs are primarily run by Jessica Smith Perry, who is the director of the Housing Opportunity Fund. So a lot of what I'm going to talk about today is material to her work. So if there's any follow-up or deeper engagement that's needed, I'm happy to connect you with Jessica.
Great.
So if you're not familiar with the URA is about a 74-year-old agency coming up on its 75th anniversary. Very much has been focused on blight elimination and increasing the city's tax base. Recently, we shifted our focus to focus more on the city of Pittsburgh's current economic development goals, which is really about creating an inclusive city for all. That sounds like a cute buzzword, but I'll tell you, for me personally, I try to do my, practice my work beyond the buzzwords and what sounds good, and to really
Right.
drive impact for our communities and our residents. So we have a five-pronged focus right now, but the one that I'm going to focus on today is really about creating more housing that's affordable to the average Pittsburgher. We know that we have an affordable housing crisis in our city. I would argue that we also have an income disparity issue in our city that we're not fully addressing, and maybe we're relying too heavily upon affordable housing and not looking at the other side of that equation to make sure that folks have access to opportunities that will increase their income earning potential. But that's a talk for another day.
It's a good topic, though.
It's a good topic. It's a good
Yes.
topic for sure.
Mhm.
But right now people are hurting. We are going through a pandemic. It is a very frightening time. And so whether you're a renter or a homeowner, if you're experiencing economic uncertainty, the URA wanted to focus on how can we expand some of our existing resources through the housing stabilization program to look at ways to deepen that support so that we could help stabilize folks while they're going through this challenging time. So we have been a conduit for some of the CARES money that was talked about earlier. So we modified our housing stabilization program, which is really about crisis prevention. How do we help families before they're on the brink of disaster, economic disaster, and to intervene earlier so that maybe they're not facing eviction and all of the other additional costs that come with that. So that program is available to residents at 50% area median income, and homeowners and the COVID program is available to homeowners at 80% area median income. We as policy wonks use area median income, but there is a chart in the presentation on page 5 that kind of shows you what those income levels are if you're wondering what that means for you and your family. And so we certainly can't do this work alone. It requires a broad network of partners, some of those that are on the phone today, as well as what we call our HSP service providers. So you'll see the Urban League there, Macedonia Face, the Veterans Leadership Program, NeighborWorks, Pittsburgh Mercy. So we started this with 4 program providers and found that with COVID, the response was just overwhelming and people had to wait too long to get through some of the congestion. So we did make the decision to bring on additional partners that would help us to disseminate this program. So to give you a little bit about some of the statistics, so we have processed more than 1,100 applications, I think, since March. That is staggering. We've fundraised about $4 million, $2 million of that URA, sort of the Housing Opportunity Fund resources. And then the CARES Act money has also been integral in providing additional money. And you will see that our foundation community has shown up here and provided some additional support, as well as a few banks. This report is as of July 3rd. And so that at that time we had deployed about $2 million of that, $2 million of that money, and we're continuing to process applications. So if you don't live inside the city of Pittsburgh, you are not eligible for that program. So that ineligible number is typically attributed to folks who live outside of the city of Pittsburgh's boundaries. But as you heard earlier, the county does also have additional programs, and these programs are meant to be complementary and to work together both inside and outside of those geographical boundaries. From a racial demographic perspective, nearly 74% of these dollars have gone to the African American community here in Pittsburgh. So a lot of that is single female head of household, and so 82% female, 18% male. So we are seeing a large representation of African Americans subscribing to these very, very important programs. So there may be a question about, I need support, I need services. How do I start? How do I get somebody to support me? So we have a partnership with United Way to do coordinated entry. So you saw that we have a host of providers, but what we try to do is sometimes there are resources that are better than the URA's resources to triage whatever that family is going through. So United Way works through the 211 system to ensure that sort of there's a some traffic coordination there to get you to the right provider. We are able to provide this in other languages, and they do maintain a database, as I said, of hundreds of partners and programs that can be stacked and work in tandem with our program. So COVID-19, again, this has been unprecedented. We've not seen a pandemic like this since the Spanish flu in 1918. There's a lot to be learned from that. And so what we found is that, especially in bureaucratic environments and in public agencies, we have a lot of rules, and those rules exist for a reason. These are public dollars, and we want to make sure that they're being allocated responsibly. But when you're dealing with the pandemic, you have to sometimes find a way to work around some of those standards so that people aren't they're in a holding pattern while we're trying to figure out paperwork. So a couple of the things that we did was so we tried to not deny, we're not denying applications for lack of income during this time. People have experienced some loss in income. So if employers are not able to provide verification, we've provided workarounds to make sure that people are not encountering barriers. If you've worked with me or you know me, you know that I'm a stickler about putting up artificial barriers that keep people from the opportunities and resources that they need. General documentation and signing. The URA was sort of a paper-driven organization. COVID-19 helped us to recalibrate, and we are now doing electronic signing, doing video conferencing the way we're doing today to try to help and support people. And then so we are using taxpayer dollars, which means that you need to be current on your taxes if you are a homeowner, or if your landlord is not current on their taxes. We typically cannot help that renter, but we are relaxing that standard for a short period of time to ensure that folks are not facing eviction, and that they're able to stay current on their rent during this moratorium. So we do have language access. And then there's a health management information system that we use just to coordinate and understand what's happening across demographics, but it's optional to be a participant in that. As I said, we have two programs. We have the traditional housing stabilization program, and then the CARES Act money allowed us to modify that program to deepen our support, particularly for homeowners that we knew would face a hard time. So you do see here which program is able to do what. So that's up to $3,000 to support utilities, rent arrearages, paying your rent forward. The traditional program can be tiered with other programs. Due to duplication of benefit issues, the CDBG CARES Act money cannot. We have to do some additional due diligence to ensure that that's not happening. And our standard HSP program does not help with mortgages, but our CARES Act program does. And so when you talk to us, we do help you figure out which program you qualify for. You don't have to worry about that. We have a great screening process to help you figure that out. I know that there was a question about eviction prevention. And so we do know that once the moratorium is over, that folks may be facing eviction. So we wanted to be proactive and provide some support to folks that may be going through that with our partners at the YWCA and Action Housing to provide people with support in working with the housing court and getting funding that will help to preclude any eviction. And this is not a panacea. We need more tools in the system working cooperatively, but we want to stand up and be leaders in this space and at least be the first ones out to say this is a model for how it could be done and to attract additional resources. The county sort of has a parallel program. Again, the URA's boundary is limited to the city of Pittsburgh proper. However, Allegheny County has taken the same position that we have, and they've been actively working to revamp their housing intervention programs. And so I do provide some information here that it's up to $750 for up to 6 months of assistance. And then that's homeowners may receive up to $1,000 a month for up to 6 months. And I believe one of our earlier panelists spoke about that. And so I did provide another document here that sort of gives you a one-page reference of all of the resources across systems so that you can have a one-page, one point of entry. This is also available on our website. So it talks about the URA's program, the county's program, and then some landlord-tenant mediation programs that are available to folks. On the home ownership front, so our Housing Opportunity Fund also provides down payment and closing cost assistance to first-time home buyers. We do also have a development affiliate that is building affordable home ownership in partnership with HACP. Castor mentioned earlier that, that we have a partnership. And so that partnership allows us to deepen the affordability on an individual home for purchase by stacking what are called second and third deferred mortgages together. And so Castor and I are thinking very creatively about how we can expand the reach of home ownership to Pittsburgh residents, particularly our low to moderate income community. And so this is how you can stay in touch with the URA. If you have questions about any of our housing programs, the fastest thing to do is to email hof@ura.org. And if you would like to talk to me or continue this conversation, here are my social media handles. I'm happy to continue to talk through some of this. Thank you. That's the entirety of the presentation.
No, that's great. Thank you. And if you wouldn't mind, Diamante, if you could share those in the chat.
I did.
That folks, oh, okay, great. So that folks can get that there. That's all been great information. I know that I see some of our activists in the community that work a lot in housing. I see some of them have joined us, and they're good friends of mine, and they work hard at helping to try to help as many people as they can with housing issues. And I'm hoping, I didn't see any of them ask any questions through the chat. I did see one on the affordable housing communities outside of Pittsburgh, because obviously we have people here that do live in the county, and that would be Elder Moore. And I think that she, from the county, has given us some information. I hope you all got some good information. And I would ask too, if you would, Sadiq was trying to put some of the website information in the chat for everybody, but if you could put it in the chat for us, then we can share it out with everyone. Some of the speakers that did not. And I'm hoping that addresses oh yeah, I do see, she did put in there, affordable housing programs from new construction through the county that do occur outside of the city of Pittsburgh. So that's new construction. So there is some information in there as well. You guys are such a wealth of information. I mean, like you said, it's kind of hard. That link that you put in, that's very helpful. I wish I could do that. Maybe as we continue to do these things, I'll get a little more techno savvy here.
This is great. This has been a great platform. Thank you for providing it. This is wonderful.
Absolutely. Thank you very much. I appreciate that. Luther appreciates that. I'm sure you guys are wondering. I don't know if you've seen his name. He's there. He's listening. He's watching. but he will join us a little bit later. We are right at, Castor, did you have something else that you wanted to add before we close this panel, or are you okay? Oh, I'm sorry. Oh, clicked it too many times. There you go.
Yeah, what I would say, just
I'm sorry. Yes, go ahead.
Housing Authority website. I don't have the skills as Demonte, so but generations apart. So
Right,
anyway,
exactly.
but the other thing is, I think I have a reputation of seeing anyone or talking to anyone. So if people contact the Housing Authority, you know, they want to talk about anything, I'm available to do that. And the information is out there on the website. So that's all I want.
Great, thank you. So we are coming to the close of this hour of conversation. I learned a lot. I hope you all did. And we're looking forward to the next group of people joining us, speakers, not just people, our speakers. This has been really great. So I would ask Sadiq, if you would please, before you're going to do the introductions for the next group of speakers for us, if you would please, would you remind everybody, I'm going to highlight our last speakers, and if you would remind everybody who our sponsors are, and we'll get ready for the next panel. Thank you again, everyone. You're a wealth of information, and we appreciate it.
Thank
You're
you.
welcome. Thank you.
You're
Thank
welcome.
you.
Before we go, Ms. Moore, I believe you wanted to.
I did. I just wanted to address Miss Rainey with what she had asked.
Oh, great.
And that was that long question. And I did say to everyone that there is a way. HUD has actually provided some opportunity for folks to be able to not lose their sites. And so if she goes and she looks through the CARES package, that she will find how HUD actually responds to the questions. And what Castor Binion said is that if you're in public housing in Section 8, you're protected. The other thing I want to say is that we don't have URA in the county. That's basically the city, but we do have some counter agencies that do help. And so I will say again, contact me. I'm very available, and we can take it further than that. So thank you.
All right. Thank you.
So much. And just to reiterate before we move into our third and final session, that this event today was made possible by our gracious sponsors. We have First Energy Foundation, UPMC, PHFA, we have Highmark Health, Allegheny County Housing Authority, the United Steelworkers, as well as Gateway Health. So thank you all for your participation, your involvement, and support. And we are going to begin by introducing our third session, which is training and employment. And this will be spearheaded by Dr. Quentin Bullock, President of the Community College of Allegheny County, Representative DeWitt Walton, County Councilman for the United Steelworkers and the A. Philip Randolph Institute here in the city of Pittsburgh. So if you all wouldn't mind introducing yourselves as well as your organizations, similarly to our previous panelists, and just talk a little bit about some of the strides that you all are making through this time. And to all of our guests and participants here on the call today, please feel free to insert any questions that you all may have into the chat. And if I'm not able to address them, we will save them for the Q&A at the end. Thank you all. And Mr. Bullock, if you are on the call, can you please take it out for us?
Good morning, good afternoon, everyone. It's a pleasure to have a chance to speak with you about all the exciting work that's occurring at Community College of Allegheny County. CCAC is a comprehensive institution of higher education that offers over 160 credit, non-credit programs in the areas of healthcare, STEM, skilled trades, business, and other areas that are continuing to grow in demand. As we all know, we are in the midst of COVID-19 pandemic. And CCAC has done major work to align the delivery of its program in formats that can accommodate training and allow our region to earn the necessary credentials to go directly into workplace. So you probably asked the question, well, what are some of those areas that we should begin to look at? Some of the beginning demands that are there are in the areas of CDL, truck driving, because there's an increased demand for drivers in our region, and we are offering a very competitive 8-week program at our Boyce campus in Monroeville. We've had close to 100% placement. The ones that were not placed, the ones who decided to do something different. We also offer programs in the information technology and cybersecurity, because this is also a growing area in which many are seeking assistance, seeking individuals with skill sets to help navigate the work within the various areas, in the areas of IT, because many things are being transitioned into the IT format. Bringing persons on with those skill sets is a great reward. Now, of course, one area that's in high demand, of course, is in healthcare. You can never go wrong with the number of healthcare providers that are available to assist and provide the necessary nurse.
Mr. Bullock, are you with us? We're losing your audio.
I got disconnected.
Okay, there you go.
I'm not sure what happened. Healthcare is the other area in high demand. We offer a 2-year registered nurse program that prepares persons to go directly into the workplace. Respiratory therapy is another area. Of course, with COVID-19, the number of respiratory therapists that are working in our healthcare field, we cannot produce enough graduates to respond to that need. But I think the most important thing is that when you think of healthcare, and healthcare specific to our region, there are so many areas in demand, from the basic entry of a certified nurse assistant to a phlebotomy, to surgical tech, to anesthesiology technician, all which are 2-year programs with strong clinical connections, and then almost 100% placement into the workplace. So CCAC is an excellent resource. We're very competitive in our costs. We have exceptional teaching faculty, and we are accessible from across the entire county with 4 campuses and 4 centers, and 1 center in Washington County. Our most exciting initiative that we are currently working on is the new construction of a new workforce center to increase access to our urban core. It's being constructed on our north side area, and it will bring to that location training in the areas of artificial intelligence, robotics, cybersecurity, information technology, culinary arts / hospitality. This is one more step in how CCAC is demonstrating its commitment to our region's workforce and bringing high demand, skilled training jobs that offer very competitive wages to our residents, and to also demonstrate our responsiveness to our region. So we are very excited to be a partner and look forward to contributing to the education, growth, and development and workforce training of our residents.
Can I just interject something there, Dr. Bullock? First of all, thank you for coming. And I just think that the cyber security is such, if I was a young adult looking for a new career, I would go there in a heartbeat. I think that that's going to be such a demand for that, and it's such growth in that area. I mean, you guys are always on top of, which is one of the reasons I think CCAC is so great in this area, especially. It's just really on top of things, and I just think that's great.
And the cybersecurity is connected to the criminology program, so it provides not only the criminal justice foundation, but it also connects it to the cybersecurity component, where students are able to prepare for a pathway into policing and areas within policing, or transition into cybersecurity in any one of the sectors of business.
Yes. Sorry, I didn't mean to interrupt. Did I interrupt?
And then the last,
yes, go ahead. I'm sorry.
the last area would be, I'll share a model that we've been working on in Homewood, Rushton, working in collaboration with the Community Empowerment Association, where in partnership with CEA, they help identify residents, connect them to the required wraparound services, which is including health, housing, childcare, food, and any social services that they may need. Once these areas are addressed, they're then referred to CCAC for workforce training. And the trainings that we do have at our Homewood to assist have included a new barber program for persons who may have been incarcerated, looking for a new beginning, who may have some challenges in getting access to other areas of training. That this allows them to learn a skill, and we've connected that to entrepreneurial, where we are teaching them the business foundation, so that not only will they learn the skill, they'll also have the foundation to open a business. So entrepreneurial is another area in demand that we will be seeing growing in our area.
I actually have a nephew that just graduated from high school that wants to become an entrepreneur, wants to become a barber.
Oh.
So yes, and open up his own shop. So we were trying to think of how Luther and I were talking about how who and what we could introduce him to help him in that process.
Well, we have that program right at CCAC Homewood Rushton, and it's an excellent program that it's completed within 1 year, which includes all the clinical components and licensing.
Wow. Well, that's where we're going to send him.
please send him to us.
Yes, absolutely. While I'm here and on a roll, I guess I should say hello to Mr. DeWitt Walton. Were you done with your presentation, Dr. Bullock? And
yes, and I can add on later as questions come forth. Thank you.
Okay, and the other thing Luther just reminded me before we go, and I'm sure you know this, but we wanted to congratulate you because we were congratulating Erie about their new community college.
Yes.
And you know the struggle that they had to get a community college in Erie, and Andre Horton worked really hard to make that happen. So he'll be with us a little later this afternoon to chat. So yeah, it's great. Thank you for your help on that.
Absolutely.
Mr. Walton, how are you? Representative, U.S. Steelworker, A. Philip Randolph, all around good guy. How are you today?
I'm great. So is that my cue to?
That's your cue, my friend. Yes.
Well, I want to start by really thanking Tmag for pulling this together. As everyone on this call knows, COVID has destroyed any sense of normalcy, any standard operating practices that organizations have tried to utilize or implement historically. And we're in a new environment, and we have to find different ways to achieve our goals and really continue to do transformative kinds of work. Dr. Bullock has done a yeoman's job, in my opinion, in terms of moving a collective agenda forward and creating additional opportunities. And he's played a very critical role in being part of the discussions that we need to fully engage in as we continue to move forward. So with that being said, I wear many hats. I wear multiple hats as almost everyone on this call does. I am a recent 1 week retiree from the Steelworkers Union, but I'm continuing to do steelworkers work. But
of course you will.
I'm program director of the Pittsburgh A. Philip Randolph Institute and an Allegheny County councilman. And those roles really created an opportunity to engage in a host of ways to really, from our perspective, look to identify, recruit, and train people from underserved, underrepresented, and the previously incarcerated communities.
Right.
It gives us an opportunity to build relationships with NGOs and governmental agencies and community-based organizations to really attempt to do three things: raise per capita income. If we can raise per capita income, we will increase home ownership.
Right.
And if you raise per capita income and increase home ownership, the third result of that will be a concurrent improvement in public safety. All those things are absolutely necessary to transform our communities.
Yes.
To make them healthier.
Yes.
To make them more engaged and truly empower the residents of those communities and our city and our country, our county and our country. So that's what our overarching objective is. I think this is a very opportune time to have these dialogues because, again, there are resources available, as the earlier speakers talked about when they Elder Moore, Deputy Director Diamante Walker talked about housing and how those things can be impacted and really give folk an opportunity to live in safe, healthy communities. And so we're all working with similar goals in mind. And with Castor, both Dr. Bullock and Partners for Work, the A. Philip Randolph Institute, are working with all of those organizations, trying to create leverage opportunities to engage in transformative work and also deal with the previously incarcerated communities. And I want to say this very early. Many of the challenges that people have is because of prior interactions with law enforcement. On October 12th, 2020, the Pittsburgh Black Elected Officials Coalition, the Pittsburgh A. Philip Randolph Institute, and the Allegheny County Public Defender's Office, as part of Operation Reset, is going to host at Kaufman Auditorium from 10 to 2 a clinic on how individuals can get their criminal records expunged. It's going to be an expungement clinic, and we're also going to have conversations about pardons. And so that's an important point that that people can use to continue to move forward in this effort to transform what takes place in our communities.
So can I interrupt you? I'm going to repeat that because I want to put it in the chat. October 12th, Kaufman Auditorium from 10 to 2.
Yes.
Okay. Do you have to register?
No, you don't have to register. We're working with the Public Defender's, A. Philip Randolph Institute is working with the Public Defender's Office. We're going to have staff there from all of the operations to help facilitate and move the process forward. So
Great.
folks just show up. There's no registration required.
Great. I'll put that in the chat. I'm sorry to interrupt. Go ahead.
No, that's it's great. It's important that we that is an important step in fixing what hasn't gone so well in our neighborhoods.
Right.
And we were, Dr. Bullock talked about a host of things that are going to go into their new workforce center. But one of the things that they're doing at the Boyce campus is doing CDL training.
Yeah.
Currently, there are rampant employment opportunities with the city of Pittsburgh with their environmental services operation.
Okay.
Their waste collection. There are openings, and the city of Pittsburgh is truly looking for applicants to fill those positions. If you have a CDL, a Class B CDL, it will be extremely helpful in gaining employment. They are short dozens of individuals that they're desperately seeking people to fill those positions as we speak.
That's for CDL drivers?
CDL and non-CDL.
Okay.
In the environmental services section department for the city of Pittsburgh. We, CCAC, the Pittsburgh A. Philip Randolph Institute, the Builders Guild, CEA, Garfield Jubilee, PCSI, has formed with what's called a construction workforce partnership, where we are looking at using that partnership to fill a host of construction positions that are currently available and will be available as part of the ongoing development in the Lower Hill, at the airport, and ultimately at Alcosan, and all of the various variety of construction projects that are taking place in this region.
Great. And you say region, not just the city of Pittsburgh.
Not just the city of Pittsburgh.
Okay.
Because if you look at the airport, that's outside the city.
Right.
Alcosan takes in Allegheny County. There are a host of projects that are currently underway, are on the books to start in the very near term. And the Builders Guild and the A. Philip Randolph Institute are recruiting individuals to begin their training programs as we speak. I can give the contact information for the A. Philip Randolph Institute. In order to become eligible for our training program, an individual has to be 18 years of age, have a high school diploma. They have to test and pass the test of adult basic education at APRI standards. They must successfully complete a panel interview. And last but not least, they must be drug-free, because we certify to our employers that our graduates can pass a 10-panel drug screen.
Mm-hmm. Yep.
Whether urine or hair. Urine, a drug screen for urine takes, you have to be clean for at least 30 days. For hair, you have to be clean at least 6 months. But those opportunities are there, paying family sustaining wages. And all of that comes is available through our CWP partnership, Construction Workforce Partnership. We are currently in discussions. The group is currently in discussions with Partners for Work for 1,200 positions that will be available in the next couple of months with Amazon at their fulfillment center that is being completed in Findlay Township, near the airport. That's 1,200 jobs starting at $15 an hour plus with benefits. So Partners for Work and our construction workforce group is trying to address some of the issues that surround transportation and potentially childcare, because we know those are inherent barriers to people being able to get to work and being able to stay on the job. So we're trying to find solutions to those kinds of problems. The Lower Hill, major construction will start in 5 months on the Lower Hill. It has been an 8-year process to get to where we are. And we are truly focusing on having positions filled by African Americans in these 3 lanes. First, residents of the Hill. Second, residents of the city. And third, residents of Allegheny County, with a preference to African Americans. So those kinds of things are taking place.
Right. Good information.
And again, there's another partnership. Dr. Bullock talked about how healthcare is a critical piece, and if you move into the healthcare arena, there is growing opportunity there. The Pittsburgh A. Philip Randolph Institute and CVS within the next 2 weeks is going to will announce the establishment of a pharmacy tech training program that will be done, that will be operated out of Ebenezer Baptist Church on the corner of Wiley and Aaron Street in the Hill District.
That's great. Ebenezer's a big facility. Yeah.
And again, that training program will be operated by the Pittsburgh A. Philip Randolph Institute, and the admittance standards to that pharmacy tech program will be the same as I outlined: 18 years of age, high school diploma, GED, or an equivalent, pass the test of adult basic education at APRI standards, pass successfully completed a panel interview, and last but not least, successfully pass a drug test. Now, an individual that starts out as a pharmacy tech, as they move through the process, if they choose to become a registered pharmacist, training and compensation is available, paid for by the CVS Corporation, where they can become registered pharmacists. But even as pharmacy techs, they'll start out at $15 an hour and be able to go all the way up to $27 an hour as pharmacy techs, nice, which are family sustaining wages. So there are rampant opportunities out here. We have to prepare ourselves and position ourselves to take advantage of it. As part of the work with with Partners for Work and the development on the Lower Hill, there's going to be a First Source Center established in the Hill District. The location hasn't been determined yet, and a career links in that First Source Center. So there's a host of things that are taking place. We have to position ourselves to take advantage of the opportunities that are presenting themselves to us. If folks have questions as we move through the process, I'm more than prepared to answer and address questions as best I can.
Sadiq, did you want to continue or, oh, let me say this before we go any further. I just got a text earlier. We were going to have a welcome from the mayor, which he could not come in, but Fitzgerald as well. And he just sent me and said he was on for this morning, and apparently I missed him. So my apologies to everyone and to him. I'd like to say he did want to come and welcome everyone to the convention, which he does every year. So he was here and I missed him. So I apologize, and we're having a great discussion. So I'm sorry he missed it, and we'll go from here. So yes, my question for you, DeWitt, and for Dr. Bullock.
I can't hear you very well, Roxanne. Can you lean forward a little bit?
You know, everybody keeps telling me that. Is that any better? I keep trying to do better.
A little bit.
Oh my. Okay. Maybe I gotta get a different headset, huh? I'm so sorry. Oh, I'll speak louder. My children will tell you I can even holler if I need to. But yes, so what I was wondering, that was a wealth of information. And is there one specific place like the Black elected officials? Do you guys have a website or something? One place where we can go, or A. Philip Randolph's website, or both, that we can go and get some of that information?
Very much so.
Okay.
The Pittsburgh Black elected officials website is pbeoc.org, I think it is. And the A. Philip Randolph Institute, our website is under reconstruction, but much of that information and contact information and the ability to register for our program is there online, and you can still register while it's under reconstruction. But our website is Pittsburgh, spelled out PittsburghAPRI.org. Pittsburgh, APRI.org.
Great. Okay. Thank you.
And our phone number is 412-562-2432. And even though we are sporadically shut down, dependent upon the status, I mean, our operating offices are technically maybe shut down. We return all phone calls within 48 hours. We try to beat that, but at least within 48 hours, folks will get a return call. Thanks, Sadiq.
You are very welcome. I just wanted to get that in there for everybody. All right. To all of our participants, did we have any additional questions for our panelists? And again, thank you to both of you. That was such a wealth of information. I've been over here taking notes. At the end of our session today, I'm going to type up a little document that has more of a comprehensive listing of all of the resources that we've been dropping in the chat. So to our participants, you all can expect that in your email as well.
One thing that I forgot to add is that we have a specific working relationship with HACP and Executive Director Binion, and with Allegheny County Housing Authority and Deputy Director Moore, that we are working to try to work specifically within those populations in an effort to, again, identify folks that may have an interest in transforming their lives and working with them to put them into our programming and create opportunities within those communities.
Wonderful. Thank you.
Anyone have any more questions regarding CCAC? I did provide the email for accessing any information about CCAC's programs and services, ccac.edu. And I also indicated details regarding the CDL training program. And if you're interested in training in contact tracing, which is current demand in many areas as COVID-19 pandemic continues to transition, we do offer that training. There is some limited funding to eligible applicants that is offered through video conferencing. It takes about 8 weeks, but it's also self-paced for persons to complete and then learn the skills that will assist you in better understanding COVID-19 management, as well as to be able to provide a service in tracking persons who may be identified with a positive outcome.
And I'd like to add this, Dr. Bullock was incredibly insightful in thinking his way through looking forward and establishing that CDL training at the Boyce campus. While I shared that opportunities are there at the city of Pittsburgh and their environmental services department, there are incredible opportunities for individuals with CDLs as well across the spectrum. Teamsters Union Local 142 down in Lawrenceville is looking for folks that can drive trucks. We have a number of our graduates from our program, from the A. Philip Randolph program, that have gone through CCAC, and some have gone through Allstate, that are now having family-sustaining careers as a result of the ability to drive a truck and making great wages. Additionally, there are more opportunities that are going to emerge as we continue to go forward. It's a peak demand, and it will be in peak demand for at least the next decade. So where folks who are not looking to follow an academic track and are looking for a blue collar track, there's opportunity that abounds.
If anyone has any information regarding the CDL program, just go to ccac.edu. We do have limited funding that is provided through Partners for Works for eligible applicants, and staff will assist you in submitting required paperwork to see if you are eligible. The same process is used for the contact tracing training. Workforce development will provide you assistance to see if you're eligible for tuition paid for through a partnership with Partners for Work. Then the last area that I would also mention for a short-term but competitive wage is in the areas of welding. We offer a 6-month, 1 year, and a 2-year certification / associate's degree that allows you to get very competitive entry wages. And as you progress up the ladder, taking the various certifications, your wage continues to grow. And that is a demand with the cracker plant work that's occurring over in Beaver County and the backfill of positions for persons who may be going to Beaver. You will have a chance to fill positions that are right here in Allegheny County.
All right, thank you. We do have one additional question here in the chat. I think this is going to Mr. Walton, speaking to the gentrification and the impact of gentrification taking place here in the city of Pittsburgh. I want to say this is specifically toward the you were talking about the construction and development that's going to be taking place in the Lower Hill. Would you be willing to speak on that for us, please?
Very gingerly. Gentrification is problematic. But gentrification, in large part, is driven by income. If we want to, you can't put legal barriers in place to stop people of color from selling their properties. You can't engage in those kinds of discriminatory acts. But what we can do is create earnings opportunities where people can have family sustaining careers. They're not forced to sell their properties, and the communities become safer and more holistic places to live. Reverend Ricky Burgess from District 9 in the city, and Councilman Lavelle from District 6 in the city just passed in Pittsburgh City Council some legislation that's supported by the Pittsburgh Black Elected Officials Coalition called Black Pittsburgh Matters. And there's a Facebook page called Black Pittsburgh Matters that outlines that whole legislation that they passed. On county council, myself and county councilwoman Liv Bennett passed a motion on county council. As difficult as it was, that motion establishes that racism is a public health crisis. And so there's an ongoing effort to begin to tackle those issues, both from the city perspective and as we continue to grow a county perspective, because the impact is the same. You can do overlays throughout the city and through the county. And you do those GIS overlays predicated on race, on gender, and income. You can easily see where Black folks live and where poverty abounds.
Yes.
And so what we're trying to do here in the city and spread it to the county with some of the progressive folks that I saw on the call, like Ms. Doucet from Braddock, because she's doing great work in Braddock.
Yes.
How we build broader coalitions to challenge those issues and ensure that people that look like us, that have goals and dreams and aspirations like us, have an opportunity to be as successful as they can be. We have to put in place protocols that don't continue to inhibit African-American success, Black success.
Right.
So there are things that are going on. For example, in the I have to give County Executive Fitzgerald a tremendous amount of credit in supporting processes that we've been having conversations about for a number of years. For example, in we had an MWDBE operation department. That is there's a national search that is going on to fill that position, but it won't be MWDBE, it'll be the Office of Equity and Inclusion. And that office will have project managers in multiple pieces of county government, in the purchasing department, in the economic development department, in the old MWDBE component. And they'll all have specific tasks to expand and increase the share that goes to minority vendors and entrepreneurs, to create an expanded class of entrepreneurs. Because the county, when you look at the county budget, the county spends well over $3 billion a year. Well over $3 billion a year. We have to ensure that there's expanded opportunity for more of those revenues to benefit people that look like us, have dreams and aspirations like us. I don't know if that addresses the question, but that's my spin on it.
I think that addresses some. Am I on?
Yeah.
I keep going in and out. I apologize. Have little housekeeping things here and there. But I was listening to that, and I've been on the advisory board for the MWDBE, and I know that the program is developing anew under Fitzgerald since Ruth retired. So we can't, I think that helps what you were saying, DeWitt, because it's absolutely true. The county spends a lot of money. And I think that it would be nice to see some more development for Black enterprise. And so on a different conversation, I'd like to discuss that with you.
Okay, I'm always available.
I know, thank you. I'm sorry. Go ahead, Dr. Bullock, did you want to add some more to that? We still have a few more minutes before we go to our remarks, and we are going to be visited yet by Senator Jay Costa. So please help me if I miss him. I don't want to miss him too. So please help me keep track of that, Sadiq.
I think I would just add that the more that we can educate our community about how we reinvest and contribute to the growth and development of our community, it will minimize the gentrification that may be positioned to occur in various communities, because the basic foundation is economics. And we have to gain the skills, earn the resources, and reinvest to retain communities so that the property values grow and we are recognized for contributing and making a difference in the communities in which we all live and thrive in.
Yes, sir. I see there's, Sadiq, do you see that question? Can you repeat that out loud and see? I was going to ask owner for a little bit more detail. Do you understand what they're asking? The disruption of social networking, renters?
I do.
Okay, great.
I think I do. You know, our society, part of the, well, let me put it in context.
Okay.
There's a cigar shop that I hang out at where we practice social distancing and smoke cigars and engage in camaraderie. As I drive home from that cigar shop, I come down Wiley Avenue back to toward the lower hill. On the corner of Wiley and Perry, any evening of the week that it's not storming, there are gobs and just huge throngs of people that are out there. And they are not doing anything wrong. They're just engaging in camaraderie and relationships. We are social by our very nature.
Yes.
And so as renters, as communities, we build relationships that we depend on that helps us survive.
Okay.
And so that's how I the context that I take that question. Part of what we have to do, part of what Diamante was talking about, and part of what our legislators have tried to, like Councilman Lavelle and Councilman Burgess, have really tried to talk about is how we create affordable housing and sustain it with the Housing Opportunity Fund, that those communities aren't truly destroyed. Because as displacement, as Dr. Bullock said, the base of all of this is economics.
Economics.
And people are seeing communities disrupted by investors coming in and acquiring property and transforming it and raising the rents where people can't afford them and are displaced. There has been continued displacement out of the city, east and south.
Yes.
And we have to create a process that challenges this. We're looking at trying to create Black enclaves where Black folks live, Black folks can thrive.
Right.
You know, where to create a modern version of Wiley Avenue days. Mm-hmm. We have to be able to do that in a logical and thoughtful and committed kind of way.
I totally agree. Can I jump in here? Were you done with that thought?
Yes.
Because I also see my good friend, he was one of the ones I spoke of earlier, Randall, just sent in a very provocative question for everybody, which he often does, and that's okay. But I think, you know, to speak to what he's saying, that's like a serious, long conversation that I think some of the reparations is definitely an ongoing conversation that I think the country is starting to think about. Lack of Black participation in building of stadiums or any kind of building, which I think you addressed with the new county the new county development of the equivalent to our MWDBE program. I should know the name of the new one. What's the new one named again, DeWitt?
Office of Equity and Inclusion.
Inclusion, right. So that and CDB dollars, there's a lot there in that question, Randall, but I think for myself personally, there's a couple ways of addressing that. One is the economic side, which I think is absolutely true. You know, if we have jobs and we can maintain our families and we feel better about ourselves, our health is better, our outlook is better, our participation is more, and education will help tremendously. I can't talk enough about education and our community college because it's such a phenomenal place. But one of the biggest things to carry out both of those, and DeWitt, you know this, you're an elected official, and I'm going to tell everybody right now, vote.
More volume, Roxanne.
Oh, there I go again. Am I better now?
Oh,
I'm sorry. Okay, thank you, dear. I'm going here with this, and I want everybody to know it before you leave. And the people that have already left, I apologize. I wish I had said it earlier. We have to vote. We have to vote for people that look like DeWitt, that come from the neighborhoods of Center Avenue. That's where my husband and partner, I should say my wonderful husband and partner comes from, the Hill District. I'm from Homewood, thank you very much. So anybody in here from Homewood, okay, we can all smile. So, but yes, we do want to create those days in a more modern setting. But we have to reinvent this system that we live in. And one of those ways is by voting. And with COVID, please vote via mail and do it early. You can go on right now. You can register to vote. If you're not registered to vote, you can check your registration, make sure it's valid, and you can go ahead and request a ballot now. You don't have to wait forever. You won't get it right now, but you can go in and get the paperwork done. So you will be prepared and ready. We have to vote, and we have to make sure it counts. So if you get it in early, I don't think, don't fall for the hype that, it's not going to work. I have very good friends that I love dearly that won't cast their ballot by mail because they're afraid it's not going to be counted or won't get there or whatever. Until we start changing the people that make decisions that think like us and or look like us, we will not make changes to the police brutality. That's not going to change. Yes, James H., we have to stay involved. We can't walk away and not expect these issues to change. We have two men in front of us, one an elected official and one the president of a community college that's outstanding in Pennsylvania. They're both Black men. That's what we need to see. And having said that, other, I'm not trying to just say other people don't care. They do care. So, but that's where we have to put our vote. That's where we have to put our energy, and we have to make it happen for ourselves in that respect. We can do that and get involved, share information, and you don't have to go smoke. I might have to find you, DeWitt, and come and see where you guys do this cigar smoking and camaraderie.
Let's do it.
Yeah. But maybe, but having said that, just this, if you can't do anything with your family, but, Zoom with them, talk to them, see each other, or what is it? Okay, Sadiq, what is it? Facebook is what?
Facebook Live, or are you talking about FaceTime?
FaceTime. So yeah, that's, so that's my spiel. I'm sorry. But yeah, so the questions that we're seeing regarding those things, those are all valid questions. I think we got a lot of information from these two gentlemen. And the biggest thing you can do is be engaged and vote. Send your relations to CCAC, CEA, PCSI. Go down to the Black elected officials on October 12th at the Kauffman Auditorium. Be involved. If you can, take $5, donate to DeWitt's campaign or somebody else's campaign. These are the things that we do actively to participate and make those changes happen so we can get reparations and we can address police accountability. So,
and please also mention the importance for completing the census.
Oh, yes.
Census also brings resources to our neighborhoods.
Yes, sir. That's how they divide the budgets, or through the numbers that they get. They
very, very much so. It gives us, and I know we have to be prepared to really make that shift to the next panel, but it gives us the opportunity to begin to address many of the questions that followed the issue of gentrification and its emergence, whether it's about reparations. Right. For example,
exactly.
We can't fix what happened with building Heinz Field or PNC Park, but what we have done is created real standards and metrics that have to be met for public investment in the Lower Hill project. What has to be done as the part of the rebuild of the airport, we have to learn from the past to ensure that it doesn't happen as we move forward. And that ties in with the issue of accountability and having real candid conversations and well-defined metrics that people and standards people have to meet and demonstrate that are being met as we move forward. What happened. Was it wrong? Yes. Was it not in the best interest of everyone? Clearly, yes. But we can't allow it to continue. And that's what's going on as we speak. And so much of that is done by the electing quality individuals and
Yes.
the census. For example, and I'll shut up quickly after this.
You're good.
With as part of the CARES package, the county received $212 million to address some of the shortfalls that occurred as a result of COVID impact. The city got a huge share because the city didn't meet some of the population numbers, but the city got a huge share of that 212, and the rest of it will be distributed through CBDG disbursement to other municipalities across Allegheny County based on money that they've already spent to try to tackle problems that arose out as a result of COVID. You know, and so that's why it's so important that we have numbers and we can see, and that money has to be spent by December 31st, or it must be returned to the federal government. So that's why we need to have these ongoing conversations and share information that people can understand and see without rancor, with respect to one another.
Right.
About how we create an environment that is conducive to change and empowerment. Thanks.
Thank you. Yes, sir. Dr. Bullock, any ending thoughts for you?
My only closing thoughts are education is our future, and to access high quality education, the community college is an excellent first step that will provide you all the tools and support that you need to complete your desired area of study. So check us out, and we look forward to welcoming anyone who enter into our doors.
Yes, thank you.
Thank you. Thank you for the opportunity to speak today.
Absolutely. You know, that's the one good thing about these. It doesn't matter what the weather is or whatever else is going on, COVID or weather or whatever, we can all still look at each other and talk to each other. So and see some smiles. So this has been great. Thank you very much.
Thank you guys. Have a great day.
You too, dear. Take care now. Be safe.
All right. We'll smoke a cigar soon.
Okay. Works for me.
All right.
I've had this young man with me today, Sadiq, and he's been so helpful to me. You guys just don't know. And I just want to publicly say to him, I appreciate his help. And he's been very patient with me and helping me get through the learning process here. So thank you, Sadiq. You've done a great job. Appreciate it.
Welcome. It's been a pleasure.
But you can't leave yet. I didn't say all that to say he can leave. I just said that so everybody would know how much I appreciate it. Okay, so we are at our 1 o'clock time, and I didn't miss this one, so I would like to follow through with our agenda. All of our speakers, everybody has been so on point and on time. I really appreciate that. So as we come into this last half hour of our event today, again, thank you to all of our presenters and participants alike, and to our sponsors. And I do have another guest that I didn't miss this time. It's our good colleague, excuse me, in my mind, I just saw Tim Stevens' face pop up and it threw me, because I was thinking of somebody else. Our friend and state senator that works very hard to help our communities and all of his constituents. And he's here with us, Senator Jay Costa. He's probably senator to a lot of you today that are here with us, or at least some of you. And we appreciate him taking his time to come and talk to us. And we also, and again, I want to say publicly that Luther and I and a lot of other people that we do our civic engagement work with, and we appreciate Senator Costa. He's an excellent worker for us in Harrisburg. And
thank you.
You're welcome. We want to get more folks like you in Harrisburg to help us get out of these issues that we're all facing. So without any further delay, let's welcome Senator Jay Costa.
Well, thank you very much, Roxanne, and thank you to both you and Luther and Talk Magazine and all your sponsors as well for the opportunity to zoom in, I guess, and speak a little bit about some of the things that are going on in Harrisburg. And I know you heard from some of my colleagues previously, and there are a lot of things happening right now in Harrisburg and things that I've spoken with you all in the past at some of the other previous meetings discussing some of the issues for many months now. Probably about 18 or 19 months ago, back in September of 2018, myself and Representative Gainey and Wheatley and Miller and some others stood before you in Oakland and talked about, and then down in downtown, spoke about some of the things needed to be done with respect to developing some programs and changes as it related to our law enforcement community relationships that we have with our community and our law enforcement agencies, and reforms that were necessary. At that time, we put into a number of measures, introduced a number of bills that, quite frankly, didn't go anywhere. My Republican colleagues and some of the stakeholders just simply weren't interested in advancing them. Fast forward 18, 19 months, and we have the George Floyd horrific situation occur, and then the civil unrest and protests that took place with respect to the number of incidences that were occurring all across the country. Finally opened up eyes to some folks who were able and willing to want to sit down and work to negotiate some of these measures. I'm happy to report to you that we're partially done with some of the work that needed to be done. We have a number of bills that have been advancing through the process, the legislative process, that address many of the police reform measures that we talked about back in September 2018. Two of them the governor has already signed. One continues to be on the governor's desk, which he will sign. And three other measures that have already passed the Senate unanimously are waiting action in the House. But beyond that, we have about 3 or 4 other measures we'd like to see get moving. When we return, there's a chance we may return in mid-August, and then for sure early September. Let me just run through some of those if I could.
Sure.
Many of you I'm sorry?
No, I said sure, thanks.
Okay, many of you remember, obviously, certainly the Antoine Rhodes tragedy that occurred with respect to the police officer. Most notably, one of the issues that came out of that conversation was the fact that the police officer involved in that particular shooting was someone who had what I'll call at best a checkered past. Was not one that maybe had done everything that was to be done by a police officer in an appropriate manner, and had situations where there's some disciplinary measures in the past and termination measures related to unprofessional and inappropriate conduct. No one knew about it, and that was part of the problem. One of the things that we set out that we were able to finally get done in legislation in House Bill 1861, I believe it is, now for the first time, agencies are required to maintain a list of disciplinary measures against any law enforcement officer, and they're required to maintain that and then provide that to a centralized database, what's called the MOPEC, Municipal Police Officers Education and Training Commission, provide that information there. So when that person is terminated or that person leaves that employment and then goes to work and tries to get a job. So for example, in this particular instance, this person, when he left the University of Pittsburgh, Pitt would have been required to submit a document to MOPEC stating the reasons why there was a ending in that relationship. Right. When that person went to apply in East Pittsburgh, and by the way, in Swissvale as well, when he went to apply there, he would have been required to file a waiver or sign a waiver that said, I permit you to go back and look at my records and the records that are on file at MOPEC. At that point, MOPEC would be required to give that information to the person, to the other law enforcement agency, in this case, East Pittsburgh. East Pittsburgh would then know of his past. Beyond that, if East Pittsburgh said, you know what, we looked at his file, we looked at MOPEC, we, despite the fact that he has this termination or whatever incident in his past, discipline, complaint, or whatever in his past, we're going to hire him anyhow. If they do that, if they choose to hire him, they're required to make a report. And the report must state the reasons why they are disregarding the measures, the information that's in their personnel file. Beyond that, that report is subject to right to know law. So that way the public will have access to that particular hiring and know the reasons why. That's one of the measures that makes its way to the governor. Beyond that, a second bill that we worked on, and I introduced back in 2018, again, with my colleagues I mentioned, dealt with enhanced training. We needed to make certain that we had a broader scope of training through MOPEC for all law enforcement officers. I was a deputy sheriff for 5 years back in the mid to late 80s, and I went through the same training that all of our police officers go through every year now. We've enhanced it in the past to cover other issues, and that's what we're doing now. Now we're required to be able to provide training that deals with a lot of issues. One, for example, understanding implicit bias. Also understanding and learning about de-escalation tactics, and not necessarily tactics that are physical in nature, but the de-escalation tactics. Working to be able to develop better relationships in our communities as a big part of that conversation as well. In addition, when there's a police-involved shooting, then in that instance, that police officer would be required to go through mental health evaluation. And if there's something that comes out of that, then there must be appropriate programs in place to be able to address that, so that going forward, that police officer will have access to that type of mental health training or mental health resources that would need to be available. So those were a couple of the ones that are signed by the governor at this point. Another one that we worked on dealt with the issue of use of force. So legislation now requires, sitting over in this House, it passed the Senate unanimously, Senate Bill 459, essentially says that if you're a police officer and you engage in an altercation with a suspect,
when you're ready,
that you are required, and serious bodily injury occurs, the municipality is required to maintain that record. So if a police officer gets into an altercation with a suspect and that person either breaks his arm or he uses a nightstick and causes injury to the head that constitutes serious bodily injury, that police department is required to maintain a record, send that record also to MOPEC. And then the state police commissioner would then be required to look at, put together a statewide report about some of the nature of all the incidents of use of force in the Commonwealth. And that report will be given to the legislature, the Judiciary Committee and the Law and Justice Committee in the Senate, and I believe the Judiciary Committee in the House. That becomes a public document. Now, what's going to be contained in that report is the big question. And the state police commissioner is charged with developing that report. And there are certain things that must be in the report and certain things that we are encouraging him to put into the report. Things like the nature of the offense, the underlying offense, specific information about the suspect, those type of things, the use of force that was involved and what was the nature of the force. Was it deadly force, or was it force that just resulted, not just, but resulted in serious bodily injury? And also the underlying offenses that were involved as well as information about the individual suspects. That record would then be maintained by the local police department in that person's file, and then will be sent to Harrisburg, as I said. And then the other measure I told you about, it would be in the file, and the next police department wants to look into that, they'll be able to see that, as well as putting together and compiling a report that will be disseminated to the public. Wow. Another bill we passed was Senate Bill 1205, and that legislation dealt with the issue of additional training and also use of deadly force training, and to ensure that there are provisions there that address how we go about doing that. It does not change what's called Title 18, the section dealing with use of force in terms of how we define use of force, but it does address the issue of the training that's necessary, that every municipality needs to adopt a use of force policy that is recognized as a national standard, one that not just by one entity, but several entities around the country. And there are folks that do this type of work, and you look at best practices and you look at model policies that every municipality would be required to adopt. And as we know in East Pittsburgh, I don't believe that they had one, but they also need to make sure the public knows by posting it and making it available to the public. In addition to that, a major part of that piece of legislation was the banning of chokeholds in training. So going forward, no further training would permit the use of a chokehold in any training going forward. Most agencies in Pennsylvania, mostly here in southwestern PA, don't necessarily use the chokehold technique, but we wanted to make clear that in Pennsylvania, no longer will there be any type of training associated with that. The other ones that are pending is another bill on the governor's desk. So those two are over in the House. The first two I mentioned, the governor signed. And the third one deals with an issue that some of my colleagues, Senator Katie Muth talked about, and that is no consent in custody. You oftentimes hear about police officers end up engaging in some type of sexual activity with individual people they apprehend, or maybe in a setting with in custody at the local municipal jailhouse. And then there's a charge of inappropriate sexual contact by a police officer. Yeah, that happens. And so this would say, and then the defense has always been, the defense had been in some of these instances that it was consensual. Excuse me, it was consensual. Well, when you're in custody and you have nowhere to go and you're being arrested or whatever, it's difficult to provide, not provide consent in some way, I guess. But at the end of the day, that is no longer legal, or that will no longer be legal when the governor signs that. That would be a third-degree felony, saying that there's no consent in custody. So that defense is no longer available if that action actually happens. Those are the ones that are pending. So some things in the House we're continuing to work on. My colleague, Senator Art Haywood, is working on legislation dealing with, I'll call an independent investigator / prosecutor. We know there was a lot of concern about the appearance of a conflict or just not there was some concern about the potential bias with respect to some of the cases involving police officer shootings. And what came out of this, actually in 2015 is when Senator Haywood first introduced this, was this special prosecutor. And now it's evolving because we can't get consensus on a special prosecutor through the Attorney General's office because he indicated that he didn't have the manpower or the ability to be able to do that in so many instances. But what we're looking at now is legislation that would say that we have a special investigator. So if there's a police-involved shooting in Allegheny County, that Allegheny County would not be the one to investigate nor prosecute. It would be an adjacent county would be able to do that to the extent that they have an agency willing to, or a division or department that's able to do that. I think that's a good step. We're working through that one. We hope to have that done as soon as we can. The other thing that we did pass out of the Senate, I failed to mention, is something called Senate Bill 14. Senator Anthony Hardy Williams from Philadelphia has been working on this. This deals with probation reform. And what we found that there were a number of individuals who were on probation after they've served their time, whether they served time or whether, whatever it was, they would run afoul of the probation conditions, referred to as technical probation violations. And oftentimes they would be put back in jail for a period of time, until such time maybe as they had a hearing. And sometimes it could be a lengthy period of time. Now, by no means is this something that would say that if you committed a crime and you're convicted of a crime, that part shouldn't be dealt with. That's obvious. But there were a tremendous number of technical parole violators and had no consistency in the law, or excuse me, no consistency in terms of what is done in each county. Some counties may, for technical violation of leaving your jurisdiction with not letting somebody know, could put you in jail for a significant period of time. Another county, it could be different. There's a whole host of these technical violations that what this legislation does is bring some standardization to some of the sentencing. And depending upon the nature of the offense, would provide standardization and the nature of the number of technical violations as well. So it's put some more consistency to the judge in terms of what can be done along those lines. That bill is going to continue to be in the House, and we're hopeful that when we come back in August, the House comes back, that they'll address those three bills. So that's the state of police reform, law enforcement reform, and community building legislation. We hope to do more. I know that my colleague, Councilman DeWitt Walton, was on earlier. He's been a champion for community advisory boards or civilian review boards. My colleague, Senator Fontana, has introduced that measure. That's pending in the Senate. We hope to be able to move that bill along as well. But it would require all counties to have a police civilian review board. And so that's sort of a summary on all that. The only other thing we're working on in Harrisburg, folks, relates to COVID-19 and trying to promulgate resources out to everybody and do what we can with respect to getting the resources out, as Councilman Walton said, get the money out the door and get it spent by December 31st. We have remaining about $1 billion that we have to spend yet and get it out to the communities. We're looking to work with hospitals. We're looking to put some resources into preventing utility shutoffs. We're looking to put resources into nonprofit community. We're looking to put money in helping have more inspectors at the county level. We are looking to do some more business development. We did one program. We're trying to grow that as well. So those are some of the things that we're working on. So Roxanne, I rambled on quite a bit. I'm happy to have any questions that anybody has.
Well, yeah, no, that was all good talk, good ramble, good talk. But you know, some of the things, you know, at least for me and probably other folks, that we don't always understand a lot of the ramifications that go into people when they're arrested, or people when they're just the issues that come after they're arrested. You know, there's a number of things, and I think we have a few people on the call today that work in justice work and justice reform, and you know, individuals that were previously incarcerated, making sure that they have rights sustained, because I think that there's several, I guess, issues with that. So, but having said that, we do have a couple. We've asked everybody to ask their questions through the chat. So we did have a couple people have some questions here for you.
Sure.
And let me just back up a little bit. Okay. One question is addressing, I know that's part of your constituents, is Duquesne school system.
Duquesne, yeah.
And they say it's been brought to their attention that Duquesne School Board, 15 to 20% of our students could not attend online classes due to their parents owing their cable bills. So I guess that could be, I don't know if there's any remedy for something like that.
Well, yeah, I know that's been a problem across the Commonwealth. I mean, certainly there's two parts to that conversation, three parts really. One, you have rural Pennsylvania where there's no broadband deployment. So steps are being taken so that the school districts in rural Pennsylvania have access to the same level of the internet that we have, so that they can do what we're doing right now. If you live maybe in a little bit outside of Indiana, PA, for example, you could not probably have this conversation in many parts of that county. But the other part of it is people who don't have connectivity because they can't access they don't have access to the internet through cable companies and the like. So we're trying to take steps. We saw that here in Woodland Hills School District. I know in the city of Philadelphia, my colleagues saw it. And there's folks who simply can't afford to pay the cable bills along those lines. So there's three parts to that. We recognize that, and we're putting more of an emphasis on the school districts and working with the Department of Education to provide resources to identify those families and do what can be done. They should not have been denied the opportunity, quite frankly, to educate their kids through the distance learning because they couldn't pay the bill. It's through no fault of their own that they found themselves in this position. So I would suggest that if there are folks in that situation, call my office, or we can call Senator Brewster's office, I'm sure, and the Representative Dawson Davis, I believe, represents Duquesne. And we will work both with the school district and folks to get engaged to do what needs to be done, because that should not happen through no fault of their own. We need to take steps to ensure that is, that works. I know in Woodland Hills, they bought a lot of, I forget what they call those tablets nowadays. They're not tablets, they're with the students. Chromebook, is that what you said, Chromebook?
I think that's it, yeah.
Yeah, and I know that Woodland Hills, we did a fund drive, and they did a tremendous job raising the money to be able to do that, and the school board participated. Those are the type of things that have to happen in every school district. So we are looking to drive more dollars out to school districts for that particular purpose, so to do the distance learning, because there's no doubt about it that will be a part of our education for our students as we go forward in some capacity. It may be a hybrid plan, or maybe something along those lines, and it may have students that don't want to come back. But it's going to be part of our education landscape going forward for a while, at least this upcoming school year, and we need to be prepared to address it.
Yes, because it's not going to go away. There's a couple other questions in here we can combine about a couple, but I'm going to ask Sadiq, one of our speakers just sent a help distress signal. So I'm going to excuse myself for a minute and try to get them on the call.
Okay.
So Sadiq, could you, Senator Costa, this is Sadiq Roberts. He's been helping me today as our co-host. So
Okay.
we appreciate his
Nick,
help.
nice to see you.
I'll be back in a moment.
Okay. Hope everything works out all right.
Thank you.
Our next question is pertaining to a requirement for drug and alcohol screening for police officers within the state of Pennsylvania. And just to take it a step forward, if you are taking in any recommendations as far as police reform is concerned.
To the second part of the question, yes, if there's some ideas that folks have, we would certainly like to hear about those. I will tell you that on the drug testing, I'm almost certain that that's a prerequisite for, I can't say drug and alcohol, but I can certainly say I think drug testing is a prerequisite to being hired by an agency. Going back to the ideas about other ideas or further, piece of legislation we can do. I know folks would like us to have gone further in some of this space, but it's not as if we can go as Democrats, quite frankly, and folks who want to see these major changes can go to Harrisburg and get them done. We are the minority party, and we don't control the calendar. We don't control what moves or doesn't move. So the problem has been getting our colleagues on the other side of the aisle to weigh in and buy in on some of this conversation. I will tell you, none of these reform measures really moved until I mentioned to you what occurred with George Floyd and what occurred with the civil unrest and protest, which helped move the needle significantly. But also our Attorney General, Josh Shapiro, really stepped in and did a great job of bringing and building consensus with the law enforcement community. And I think he was, he was very instrumental in doing that. I'm sorry, I had to sneeze there for a second. I apologize. So it was the Attorney General who was able to bring together the statewide FOP, the State Troopers Association, the chiefs of police of all the counties around Pennsylvania, also looking at some of the other agencies, law enforcement agencies, who up to this point in time, I had no interest in advancing these bills that I talked about that we introduced back in 2018. So my hat's off to the Attorney General, build that consensus and working with everybody to get done what we could get done. There's more we want to do. There's more we could be doing, but we're just not there yet with the numbers to be able to achieve that. As we go forward, hopefully next session, we'll be able to build upon some of the things that we've already done to be able to go further in some of the space.
All right, thank you so much. Our question here is, I guess this is a more or less a two-sided question. So how would you address the great anxiety that's faced by the African-American community when being pulled over by law enforcement? And I guess conversely, the anxiety experienced by law enforcement when approaching African-Americans within their vehicle. How could you address that?
Yeah, so I mean, I can never understand ever how it would be to be an African-American and pulled over by a police officer. I cannot relate to that experience ever. And so I think the best way that I can answer that question is by saying being relaxed, being respectful, doing what needs to be done, and listening to the commands, obviously provided that they're reasonable. But that would be advice I would give to folks. And knowing that you just don't know what can happen if things get worse and exacerbated. As a police officer, I think it comes down to training and understanding and recognizing that how to deal with implicit bias, possibly recognizing that exists in folks. And I think looking at the training in terms of how to deal with situations, understanding, part of the legislation I talked about community relations, but it also is required to understand diversity, understand cultural differences with folks. That's part of the training as well. So there's the de-escalation and all those type of things, but there's also cultural awareness and understanding of individuals in the community that you're working with. And I think that's going to be able to help those interactions. So if a police officer pulls over an African-American person, that's how it should be handled. The training is going to be a big part of that. And I think that's designed to go in that direction. And it's going to be ongoing training, by the way. It's just not going to be, 2 hours and you're done. It'll require ongoing training for officers like going forward. Okay.
This is one of the questions, but I just wanted to add on to the previous inquiry. Is there any possibility of the trainings being made public? Just to provide a little bit of context as far as perspective which police officers are viewing the community and being trained on handling the community. And then additionally, is there an opportunity for a training to be developed for community members, so that, from the same voice, we can all be able to interpret this experience in the same fashion, so that there is no confusion when one
is. So that's a great point. I can tell you that MOPEC, who's required to train all police officers, unless it's like the city of Pittsburgh or state police, they have their own training. MOPEC post online the curriculum. They break down the number of hours of each part of their 13-week program, and they break it down in terms of what the nature of the training is. They don't tell you exactly, here's what we do in this training, which I think is what you're asking, is a way to see that. And I think that's a great point. I think that's something we should consider. Being some communities I know did sort of, in the years past, did a community policing type deal. Not necessarily do the policing, but they did some programming with the police, I believe. And I think that's a great point. Understanding the training and what the law enforcement community, their expectations are with respect and understanding of this nature of this training and how to deal with this situation, but also people who are in the community understand how they see it. And that goes to, as I mentioned to you earlier, the training that's being done or required to be done going forward, dealing with understanding community culture, or culture from different folks, whether it be race or gender, LGBTQ stuff, everything. Understanding that. So if we're asking the police officers to understand this community, whatever it might be, it's important for the community to understand that how the other community, the law enforcement community, is addressing these situations that would occur. So I think that's a great suggestion, something we can take a look at.
All right, thank you. Another question. I'm sorry.
No, go ahead.
Another question that we have are what are the chances of a Democratic takeover in the PA House and Senate?
Well, I hope that's a great question. Thank you. I'm hopeful that we will be successful. It starts, and you've been in part of these places. I've been up with Roxanne and Luther and so many others, Ricky and others, up in Erie, for example. That's an opportunity for us in Erie to win that seat. Harrisburg area, Dauphin County and Perry County is another opportunity with a great candidate, George Scott. Southeast PA, Delaware County. Southeast PA is trending very Democratic, and we have one in Lancaster County. But probably the two most important races right now, we can win all four of those. We have to pay attention to what's going on here in Allegheny County. Pam Ivino and Senator Jim Brewster are both being targeted with Republicans who will spend millions of dollars to try to win those seats. They have those type of dollars. We have the grassroots. We have the people power. They have the money that they're going to spend to try to do that. So chances are pretty good in the Senate, we hope. Similarly, in the House, there are a lot of great races. I know Representative Dermody and Representative Harris have been doing a great job leading our House Democrats. They have to hold 11 seats and pick up 9 more. And there's some great opportunities around the country, around the Commonwealth. When I look at some of the polling numbers with regard to Donald Trump, he's doing okay and well in the areas that he did okay and well in before. But in Southeast PA and some other areas, his support is dropping. So you go to rural Pennsylvania, continues to do well. You go into the 45th district and Jim Brewster's district, Donald Trump leading by 6 points right now, believe it or not. When you go up in Westmoreland, a little bit of Westmoreland, they come through Monroeville and Plum and go down into the deep Allegheny County, Mon Valley, Elizabeth Forward and all those places. Donald Trump's doing well and he'll lead that ticket. And that's the scary thing. So we have to work hard to ensure that we can do that. And by the way, that goes to the House races that are embedded in that district as well. So we're going to do a lot of work in this area to maintain Democrats in Harrisburg to be able to get to the majority, to come back and do the things that we need to talk about. Certainly more law enforcement reform measures, more investments in education, more investment to address the healthcare disparities that exist, more investments in the environment to try to address what needs to be done, and having those conversations. Those are the things that we have to talk about once we're in a position to be in the majority.
I can't agree more. And we are in, I'm looking at all the questions all of a sudden, and there is some, in the last election, there was a woman I spoke to from Westmoreland County, and she was very adamant that we were at an event here in Monroeville, and she was there, you know, as part of the event. And she said, and she was a white woman from Westmoreland County, and she said she had a Hillary Clinton and some other signs on her yard, and they came and burned her mailbox.
Yeah.
That's symbolistic to burning a cross. I mean, it's like, really, are you kidding me? So yeah, she was quite frightened. And she said to us, all of these people here, she said the majority of them are going to vote for Trump. And she had a point. She had a very good point in what actually happened in the election. And that really, really bothered me. Not Allegheny County, but outside, right outside.
Yeah. But it's not too far.
Yeah,
right?
exactly. Yeah,
it's
exactly.
like 15 miles away, 20 miles away. You know, there's no question that those are very seriously red counties. And the whole dispute right now is around the COVID-19 and the manner the governor's handling it. I think he's doing well, both he and Dr. Levine. So I think that that's driving a lot of this. A lot of people are frustrated, and their conservative base feels if their rights have been violated because the governor and Dr. Levine are putting in place these limitations. You know, there are a lot of underlying issues that we have to deal with respect to health disparities in our communities. We shouldn't be fighting about whether we wear a mask or not. We should be fighting about why it is that we find ourselves in a situation for African American individuals who are disproportionately impacted by this virus. It's the lack of health care that we don't provide to people in our communities that's an issue.
Initially. Mm-hmm.
Yep.
Yes. Well, there's a couple other questions. I'll see if I can help them out. I know that you've been on with us. I didn't realize how long. I appreciate that.
I'm long-winded. I apologize.
No, that's fine. I think you were very helpful with your information. We have some other folks that are going to join us. You're welcome to stay and participate or go back to your family on a Saturday afternoon.
I'm going to go cut my lawn. So
I'll be there you go.
Thank you guys again, Roxanne, Luther, and everyone. Thank you for allowing me the opportunity to be part of the program. I'm sorry we can't do it in person like we normally do, but have faith. We'll get there, and everybody stay safe and stay cool.
Yes,
thanks a lot, everybody. See you now.
Take care. Bye-bye.
Bye-bye.
So let's see. We did get the young lady. Let's see. Is she here? Yes, she is. That we were trying to get in just a moment ago. She's joining us. There she is. Kathy Huggins from Philadelphia is here with us. Kathy, can you hear me? Oh, I guess I better speak up. Kathy, can you hear me? No. Okay. She's going to give us some remarks from Philadelphia and let us know what's going on over there. Let's see. I'll try this one more time. No. Sadiq, you want to take a look? Maybe I'm doing something wrong.
Yes, I'm actually looking at it right now.
Oh, okay. So it is me. It's nothing unusual. No, maybe if I do it from there. Okay. Kathy, can you hear me? Hello? No. Okay. Okay. Well, in that case, let's go with Tim. He is here. Hi, Tim. Hi, Tim.
I didn't. Good, everybody. Can you hear me?
Yep, we can hear you.
Had a good session.
Yes, this has been a wonderful day. I'm so excited.
Oh, good stuff.
Yes.
Good stuff.
So those of you who don't know Tim, I'm sure many of you do. He's a good friend of ours. He's a good friend to Pittsburgh and the work that he does through BPIP, the Black Political Empowerment Project. And okay, Tim. We're going to let you loose on these folks, but we gotta mind our time, please. Mind our time.
Loose. I
Okay.
know.
There you go. All right. Thank you.
I was listening very carefully to Senator Costa because he just told us why we should vote in each and every election, didn't he?
Yes, sir.
Mission of BPEP is African Americans vote in each and every election, and we encourage all people to vote in each and every election. But obviously, we have more issues to deal with than some people, do we not?
Yeah.
So
we have a lot more.
We have a lot to deal with, and the issues that Senator Costa just spoke to is some of the work that the Black Political Empowerment Project has been advocating for years, one of which what we call the Due Process Act, where when there's a death at the hands of the police, that case should go outside of the local district attorney, because our feeling is a natural conflict of interest, because the DA has to depend on the police yesterday, tomorrow, and the day they're prosecuting a police officer. So that our feeling is the DA cannot be but so objective because of having to depend on the police on a regular basis. So we call it the Due Process Act. We've advocated it for years. And after the death of Antoine Michael Rose II, we brought it up once again. We shared it with our state legislators, and they did present something very similar. They didn't call it the Due Process Act as we call it, but it's basically the same idea, that when there's a death, it goes into the hands outside of our Allegheny County District Attorney's Office. So all these bills, and we've been advocating police reform for some time. We're in the midst of what we call the campaign for power. And hopefully everybody on the call can agree with that idea, the campaign for power. As we go toward the November 3rd election, we had a phenomenal call on July 15th, of which Roxanne and Luther were on. We put together a phenomenal coalition across the Commonwealth of Pennsylvania. And we're partnering with Joe Sertain and a group called the Cato Voter Empowerment Initiative out of Philadelphia. So we had, I think, over 50 persons on the call across the Commonwealth. And we had a great couple-hour conversation, hour and a half or so conversation. We're going to continue on Tuesday, this coming Tuesday at 6. We have our partners from Allegheny County will be on a special call as we follow up with the work we did on July 15th. We kind of introduced ourselves from all across the Commonwealth. And some of our partners locally include the League of Women Voters, the NACP, the Urban League of Greater Pittsburgh, Alpha Phi Alpha Fraternity is going to be involved, the Urban League. Am I still on? I don't know if I hit something or not. Am I still on, Sadiq?
Can you hear me?
Yeah, am I still on?
Yes, we can hear you. We just lost your video.
Okay, hold on.
All right.
Yeah, now? Okay. So they shouldn't give seniors these technical stuff, you know. So we have the Voices Against Violence. As I said, Talk Magazine and Tmag are one of our key partners. The Voter Empowerment Project, who's going to work with us across the state, particularly in Allegheny County, with improving our social media presence. We're going to work on that tremendously. Western Pennsylvania Black Political Assembly, Vote Allegheny, Pittsburgh for CETA, that's the Convention for the Elimination of All Forms of Discrimination Against Women, Vote PA, Voter Empowerment Education Enrichment Movement, VEAM, which is one of our newer activist groups out of the African American community, Black Women for Positive Change, Take Action Mon Valley People's Action, Statewide League of Women Voters, Allegheny Union Baptist Association, the Baptist Ministers Conference of Pittsburgh and vicinity, the Builders United of Southern Pennsylvania, West End Power in the West End of Pittsburgh, Muhammad's Mosque 22, Students Demand Action out of Moms Demand Action, Gun Sense in America, M Power, Ebenezer Baptist Church, St. James AME Church, Keystone Progress Education Fund, the YWCA joined us recently, the South Pittsburgh Coalition for Peace, Moms Demand Action, East Liberty Presbyterian Church, and Jewish Federation of Pittsburgh. We had a call yesterday, I believe it was, the day before, of another call with them this coming week. They are tying in with Jewish federations across Pennsylvania. There's going to be a statewide movement. BPEP will be partnering with them, I believe in September 14th or 15th, with a special webinar on voting. And that's Jewish Federation out of Philadelphia, out of Harrisburg, and Allentown and Pittsburgh. So that's another new coalition that we're working. They'll be part of our coalition. Voices of Westmoreland. And I just saw that there was an issue in Westmoreland County. Well, there are actually activists on the left side of things in Westmoreland County. So we'll have a tie-in there. So we're very excited about this coalition. BPEP will be having buses. Some of you may remember back in the day, years ago, we had buses across Pittsburgh and beyond. And this year, we're going to reestablish the BPEP campaign for buses. On the back of the buses, you'll begin to see, beginning, I believe, the first week of September, we're going to have buses for 2 months going in most of the routes that most of our African-American community will see. We're going to have that for 2 solid months every day. We're looking at finding some fundings for billboards as well. We're going to have yard signs. Again, we're going to have our magnet signs on the side of vehicles that we're going to have, as we did a few months ago on our campaign for power, where we have the magnets on the side of the vehicles that promote the mail-in ballot. We're going to do everything we can to encourage the mail-in ballot early. We're going to do everything we can on online voting, as well as obviously encouraging voting in person. But because of the COVID, we have no idea what's going to be happening by November. So this is a big deal. We're going to try to utilize all media that we can. And again, extreme use of social media at a level that we've never done before with Facebook, Twitter, YouTube, and whatever. Creating webinars and events in whatever level we can. Having our BPEP vote posters that we've had for years, we're going to try to have those in every business that we can, every church. And if there are folks online that would like to work with us, I should say, email us at CAV. CAV is in Coalition Against Violence, cav.pgh. Sadiq, if you want to get that, cav.pgh@gmail.com. CAV is in the Coalition Against Violence, one of our initiatives, cav.pgh@gmail.com. Our Google number is 412-212-8775, 412-212-8775. And we're looking for, with all the organizations that I listed, and those are just the Western Pennsylvania. Again, we're going to be doing this throughout the Commonwealth. And one of the things we want to feature at times, particularly through our social media efforts that we're going to be creating, is marketing what other entities are doing as part of this statewide effort. It's not just going to be a BPEP thing. It'll be Campaign for Power, partnering again with Cato Initiative out of Philadelphia. But we want to highlight what different entities throughout the Commonwealth are doing to promote voter registration, voter turnout, voter education. We will partner with everyone that we can. We mentioned some of our key African-American religious organizations. We're going to be trying to speak very powerfully to our religious community to be strong partners in this effort. This is, I think all of us on this call can agree, one of the most historic elections in the history of our nation, in the history of Black people. We have to remember that the Supreme Court is at stake. There are many 5-4 decisions, are there not? We have to remember that whoever the president is will determine the profile of the Supreme Court of the United States going forward for years to come. If we realize the current president has appointed, I believe, at least 150 federal judges. If you're following this, most of the judges are in their 40s and 50s. So they're going to be on the bench potentially for 20, 25, 30 years. So Donald Trump, if he's elected or reelected, if he's elected or not, he is already going to impact the profile of this nation for literally a couple or maybe a few decades to come in terms of the rulings in the courts. All that we've seen of the discrepancies that have come forward that we already knew about have been made clearer with the COVID-19, the discrepancies between Black people and white people in the city, the country, and the nation. If that doesn't allow us to have an incentive to vote, I don't know what will. But again, cav.pgh@gmail.com. Email us if you want to get involved, have your organization become part of this great network across the Commonwealth of Pennsylvania. We have a call this coming Tuesday at 6. We want to acknowledge and thank Luther and Roxanne for their commitment to be part of the network that they already helped to develop across the network of the Commonwealth of Pennsylvania. We want to salute them for the work they have already done, and they've agreed to be a strong partner with our work. So we thank you for the opportunity. Our efforts will be led by our Civic Engagement Coordinator, Lorraine Cross, who's been a phenomenal volunteer for us, and Celeste Taylor, who used to be Roxanne, our Vice Chair of BPEP years ago, is coming out of semi-retirement. And we've been on some calls together and text messages together, and she will be one of our key organizers for this great effort. So we thank you for the opportunity. And listen, what Barack Obama said when he was running, we need to get fired up. There's no question. We need to get fired up. If we don't have Black people voting in this election, you know we're anti-violence, Roxanne. You know that, don't you?
I know that.
When people don't vote in this election, we need to beat them with the BPEP stick.
I'm afraid of the BPEP stick.
We need to get out the BPEP stick. And let's be honest, some Black folks will come up with reasons why we shouldn't vote. Am I right? We will come up with reasons why we shouldn't vote. Well, let's put it this way. Let me use this analogy. If you go to the store and decide what you want for dinner, and you bring it back to the house, guess what folks are going to eat? What you selected. So if we are not at the table to decide,
that's right,
who is going to be elected, who is going to be selected to serve on the courts, who are going to be selected to serve on commissions and committees and task force locally, regionally, and nationally, guess who will make those decisions?
That's right.
If we are not part of the process, other folks who may not have our interests at heart will make those decisions for us. We have to be at the table of decision making. We have to be at the table of power. We have to be elected, and we have to be selected to help decide the decisions of our city, our county, our Commonwealth, and our nation.
Absolutely agree. Absolutely. Yes.
And we must vote in each and every election.
Well, that was going to be my follow-up to that statement, Mr. Tim.
Yes.
Yeah, only way we become a part of the table is to vote. Absolutely. And to do our census, as Dr. Bullock reminded us earlier, do our census and vote. So I was able to get together with Miss Kathy Huggins. Her name is Kathy Huggins. She's calling us from Philadelphia. We couldn't get her connected to the video, but we did manage to get her connected to the call. So let me try this and see what happens. Let me go back down here. Kathy, can you hear me?
Yes, I can hear you, Roxanne.
Great, great, very good. So Kathy, I've introduced you as partially, she's part of the Tmag family, and we work with her and some other friends of hers and acquaintances of hers and colleagues of hers in Philadelphia to do the work on the work that Tmag does: voter engagement, civic engagement, education, and participation. Before I forget, and don't say this, I say this for all of our meetings, and I want you all to take it to heart, because you can think of something, but this is a call to action. This is not a time to sit back. This is a call to action. We can all do something. We don't all have to be out on the TV or, going across the country or whatever, but we can all do our part right where we're at. We can do something, and voting is one thing we can all do. So having said that, Miss Kathy, are you still there?
Yes, I'm still here, Roxanne.
Well, go ahead, please, and share your thoughts and concerns about Philadelphia. What's happening over there? Is there something that we can do to help? And what can we do to all get the vote out? And I didn't mention that you're part of the Democratic Statewide Committee. So
Your state committee.
Yes, she is on the state committee. So she does have some ideas about what's happening and what's going on. Thank you, Kathy. Please go ahead and share.
Okay. Well, Lisa Rhodes, who's the chairperson of the Black Caucus for State Committee, we are trying to work on voter registration to get the people registered for November for the election.
Yes.
To get out the vote for Joe Biden. We are trying to work on that. And we just got 3 Black women on DNC, Sydney Bass, Linda Fields, and the young lady out of Pittsburgh. I think her name is Sheila.
No, it's Sylvia Wilson. Sylvia Wilson.
Yes, Sylvia Wilson. We got them on DNC for the DNC for next year. They will be our 3 candidates to be on DNC.
Right.
So that's what we've been working on and trying to get the vote out for Obama. I mean, not for Obama, but for Joe Biden, and we hope we be successful. And we need to tell our Black people we need to get out and vote. I don't want to hear this, that I don't want to vote because of this and that. We need to vote. We need the young people like they out here fighting for everything else. We need them to get out and do that.
That's right. You're right about that. Who was the second lady that you said?
Linda Fields from Montgomery County.
Did she run for an office at some point?
Linda ran for Senate. She ran for Senate, but she didn't make it.
Okay. Yeah, I thought she sounded familiar. Okay, I'm sorry. Please continue, dear.
So that's about it, Roxanne. We're just trying to work on the Black Caucus. Lisa Rhodes is doing a good job with the Black Caucus for the state of Pennsylvania.
Yes, she is. Well, I appreciate that. And please stay on with us and interject as you see if people have any questions on what's happening over in Philly. Kathy's there, can help us with that. And
Cherie Street is working on some things too with us. Senator Street.
Senator Street out of Philadelphia, yes.
Right. He's working on some projects too.
Great, that's great. So what we'll do, hopefully with one of the next events that we're going to have, our roundtable that we usually have in Harrisburg, we'll get Senator Street. I'm sure it's going to be done virtually just to give everybody here a heads up. But we're going to do it. And whether we can go or not, we're going to do it. And we would definitely like to get him to say a few words when we do that event as well. So having said that, stay with us, Kathy, and interject.
I will stay with you.
Okay, great. So what Luther just tapped my arm and he said, don't forget. And I said, he's right. He's absolutely right. We have young Miss Elaine Harris Fulton with us, Wake Up the Vote out of Wilkinsburg, who has really done tremendous work out of Wilkinsburg. And I want her, she's been with us all day here, and I appreciate that. And I want her to know how much that means to us. She does a lot of work, and we're going to put her on the spot, and we're going to ask her to say some words and give us some information on what they're doing in Wilkinsburg. She has done a tremendous job with Wake Up the Vote. And so, Ms. Harris Fulton, give us some words of wisdom, please. Oh, wait, did I unmute you? No. Yes.
Okay. You can hear me?
Yes, ma'am.
Oh, yes. Okay, so we're working hard on trying to really get out the vote and on mail-in ballots as everyone is working, kind of doing the same thing. But we're looking at a new way of doing organizing, which people are calling relational organizing.
Okay.
And we're looking for individuals that are willing to join us with what we call democracy champions. And when we're looking at democracy champions as getting individuals in communities. They put out our yard signs, like I have some posted back there that says a democracy champion lives here, and wake up to vote, embrace democracy. We also are working with Polls to Polls. They make these cute vote signs out of material to put in your yard. We're figuring that if people start seeing, if we start decorating our communities about voting, people may realize the importance of voting. Because usually during an elections, a lot of times we were finding out that people didn't even know an election was going on. There was nothing really out there about the election. So we're trying to get people together in the communities to do this. And what we're asking of the individuals is just that they talk to people they know, their families, their friends, their associates. Statistics shows us that more people vote for people when people ask them that they know. So if someone, you know someone and the person asks you, will you vote this year? It's better than a stranger coming up to you and asking you to vote. And they call that relational organizing. So we're trying to reach out in different communities and pick out people that do this, and also give them signs, give them the signs they need to put out in their yard. Also, you know, we have some little tokens and things that they can give out and stuff like that if they want to give them to their family and friends. But we're thinking that might, you know, everybody wants to do something, but they don't want to be, well, you really can't canvass, okay? Right. But we're just saying, all we're asking you to do is talk to your family, friends, and the people you associate with. We're not trying to tell you to go out there and reach out to strangers and stuff. And I'm figuring if we get enough people in the community that are just doing that, we might be able to increase the voting to probably your most hard to reach individuals.
Because it's a connection, yeah.
Right. So, and we're also looking at on September the 22nd, National Voter Registration Day. We're going to do,
I'm sorry,
September, excuse me, September
22nd?
Yes, September the 22nd, National Voter Registration Day. And we're going to do a caravan and ride through the streets, talking to people, and also getting out from time to time, setting up tables. I've already brought masks and face shields for the individuals that are going to help. So we're going to make sure that they're totally protected out there. But we just want to move through so people realize something's going on here and stuff. As much as possible, just being visible to the public I think is so important, and they start to realize the importance of the election this year. Now, we've been having a lot of feedback from people who really believe Trump is doing a good job because they keep hearing his talking points. He's the loudest voice in the room on TV. So like people are reporting back those talking points. So it's important to get out there and let them realize, and we're a neutral organization, but I'm just saying, I'm hearing this feedback. Right. So it's just important for people to see people that are out in the street that are talking about Biden, even though we can't do it on our caravan, but we need to make more of a presence when I'm not doing this, I'm over here because I have my separate life. Doing this Biden thing, because I'm realizing I'm talking to people that you have to kind of explain to them that no, Trump is not the way. Okay. No. Yeah. So don't think he's doing a good job. And I wanted to ask Jay Costa when he was on, are they doing some proactive stuff about thinking about if Trump decides to send troops here because he realizes that we're a threat as his numbers go down in Pennsylvania,
Yes.
you know, it seems like he might start, because I think the whole thing with the commotion is to scare people into thinking he can come in and solve it. So, I mean, I think Pennsylvania would be a target area if his numbers keep going down, because I know they're assuming he's supposed to win here again, even though the numbers are not saying that.
Well, I think you're absolutely right. And I will try to ask about that.
Right.
See if I can't find out some answers on that as well. I hear an echo. Does anybody else hear it?
Yes, it's coming through.
What did I do? Oh, is that because he's connected as well? Sadiq, did I hear you say something?
Oh, is Mr. Luther sitting next to you?
Yes.
Yeah.
That's why.
Oh.
You want me to get on yours?
Sadiq, can you mute him?
Yes, ma'am.
Okay, mute him for a moment. And so yes, Elaine, I think that you're on point with that, because you know, once we get down to the nitty gritty, things like that will make a difference. And
right.
There are people of color that we've talked to that do indicate they may vote for him.
Right.
And so we are like you, we're a nonpartisan organization, like BPEP is nonpartisan. We want to support people getting out to vote. It's critical. But we need to be conscious that if we do run into people that we're actually talking to, there's the education piece that we can share about what's really happening, what the numbers are, and you know, let them know that things are not what they appear to be. If you think that it's so wonderful, we should look at the people that are in food lines 2 weeks after they shut down and lose their job. They're in food lines. They can't pay their rent. And, you know, it can't be all that great if people cannot maintain at least for a couple, 3 weeks, let alone for these months. You know, I get that. But so we need to just make them aware. And I know that you can make them aware of what the real issues are and the real statistics say. And, you know, so yeah, I think that your point is very well taken. Thank you very much. And thank you for jumping on so nicely and sharing what you guys are doing, because you do great work out there. And I know that between now and election, we're certainly going to be in touch. We'll work with you guys. We're going to be working with Tim and the other organization. And we chuckled when we heard you talk about the caravan, because I don't know if you recall, just before the primary election in June, we had a caravan.
Right.
And we went all over the city. We went up into Arlington. We went up in the Homewood, Hill District, Garfield. Remember, Tim? Remember that, Tim, when we did
Absolutely, that was great. The energy was wonderful, and it was we had people from different organizations represented, and it gave a nice energy, and we're going to do it again. Absolutely.
Yes, we'll do it again.
We appreciated you being a part of it. Absolutely.
We could, yeah, because well, yeah, the assembly, which Randall's still on here. I
Absolutely.
think.
Randall was there.
Yeah,
Rick Adams.
Yep, and it was something to bring the organizations together, because it was, you know, when we first started working in our group to try to start putting it together, it was like, okay, so where do we go from here? And it ended up being phenomenal. So it worked out really well. So yeah, that's a good idea, Elaine. I think people, they do get engaged when they see you riding around blowing the horn, and it's like all these cars riding through. They're like, wait,
right.
What's going on here?
Right.
That was nice. So we are about a half hour now or so over our time. So I appreciate everybody that hung in there with us. And
I talked to Mr. Ford. I was on the call.
Wait a second. Kathy, are you talking to us or someone else?
I was talking to somebody else. I was talking to Lisa, trying to tell her to get on.
Oh, well, we're actually getting ready to close it out. So please give her our love and ask her to join us on the next one. We will be having another one, and I'm going to tell everybody that's here in September, we're going to be talking to people specifically in Reading. So again, we will have people from across the state. We will give you an invitation to everybody. but the key speakers will be coming out of Reading, because the work that Tmag does is across the state, and we are trying to build our relationships, build our network, so that the elected officials do know, that we have those, what did you call them, Elaine? Those relational organizing.
Mm-hmm.
We believe in that strongly, and that's why we always talk about the Tmag family, because it is who we talk about. If we talk to Uncle Burton sitting over there, been here all day, and Randall and Rick Adams, the people that we've lost during the day here that are starting to leave, those are people that we depend on and that we work with all the time. And Elaine and Kathy and Lisa Rhodes out of Philly as well. And Atiba Johnson, I can't pronounce his other name, sorry, but he's here with us in spirit. So yeah, I can't say enough about everybody. We appreciate you joining. A lot of you that have stuck with us throughout the whole day. We will send out the survey.
I'm sorry that I wasn't on before.
Well,
I forgot.
That's okay. You'll be on the next one. I know. You go with us everywhere we go, don't you?
Yes.
Thank you. So
Roxanne,
yes.
just want to thank you on behalf, I'm sure, of everybody, for you and Luther for organizing what you've done today and all the things you've done over the years, and for being
thank you, sir.
Just a great citizen to the Black community and to the Commonwealth in general. So
thank you.
That is my friend. So I want to thank you and Luther for your leadership.
Thank you, Tim. Likewise, our friend and our church family.
That's right.
That's right. Way to go, Trinity.
AME
Trinity AME. Yes.
African Methodism.
That's right. That's right. So I'm not sure. I'm going to go into a view here, and I'm going to also open up Luther's mic. He's been here all day. He hasn't had anything to say to us until now, but Mr. Sewell, I have opened your mic. I'm going to close mine. But before we go, I was just looking to see if we have any ministers with us. I do not see any by distinction or the name or that I know of. So before we leave, Luther or I will take a moment and say a closing prayer. So here's Luther Sewell.
First, I would like to thank everybody for being on.
A little closer, Luther. Pull your mic closer. He's not coming over at all.
Oh. Come here. Come closer. It's Sadiq.
Luther's muted.
You're muted on your end. I'm unmuted on this.
Is it still muted?
Okay, we can hear you.
Okay, I would like to thank Sadiq and Roxanne for putting this together. It is more than a pleasure for me to really communicate with over 100 people today. I've been keeping a tally of it. As you know, our publication Talk has been in business for some 58 years throughout the state of Pennsylvania, and we basically produce.
Luther, could you use Roxanne's mic?
Roxanne, can you unmute yourself?
Okay, do you all hear me now?
Much better.
Okay, good. Okay, as you all know, we are in 31 of the 67 counties in Pennsylvania with our network. So we are talking to people all over the state of Pennsylvania. On the 12th, we will have an online conference in Reading. Then we will go to Harrisburg and Philadelphia with our online. And then we will end up with Erie on our online. So we're going to make everybody aware of those connections with all parts of the state. One thing that we are doing in July and August is raising funds. We're raising funds so we can do our own and control our own get out to vote and to vote by ballot. So if we use our own money, we can do what we want to do. I believe in independence. I've always been independent, and I hope that we strive to be independent. The one thing the Democratic Party has to learn is that Black lives matter. The Pennsylvania Democratic Party does not believe that. That's why we have so many problems with the party. So I look forward to everyone being on the calls for our next 3 conferences, and thank you all. Now I will do one thing. No, I'll let Roxanne pray. Oh, she tell me I can pray. Our Heavenly Father, we thank Thee for this time to fellowship and to be together. We hope to serve our people like we've never served them before. We hope we get this victory in this upcoming election. Bless everyone who is on the line today and those who would love to be on but couldn't get on. Praise your holy name. These things we ask in Jesus' name. Amen.
Amen.
All right, good job.
Toby, oops, I guess that's it for me. I will. Okay, so can you guys hear me?
Yeah.
Okay, so I was just going to say goodbye. You can exit as you are familiar with doing, and we will talk to you all again soon. We will update you with notes and a survey as well.